Thank you. It's working. Yes, it's finally working on YouTube, so I'm free to to continue. Yay! So welcome everybody. Welcome everybody to the Homeschooling Conversations 2021. This is the third edition, and I think we're right on track for our schedule. My name is Tomilola Olatunde, and I am the host. I'm going to be your host for tonight. Um, First of all, the reason why I started the homeschooling conversation was like 3 years ago, definitely before the pandemic. Homeschooling was not, everybody that was homeschooling was doing it hush hush and not exactly talking about it. And finding information about homeschooling for me when I wanted to start was difficult, especially, it wasn't difficult as far as the kind of information that was out there was for the other countries, but not tailored to Africa or tailored to Nigeria and all of that. So that was one of the main reasons why I felt that it was needed for us to start this conversation and have it. And although I never knew that, we'll do another one the next year, my husband was like, you started it now, so you got to continue. So, and this year, for obvious reasons, because I just gave birth like a month ago, I did not want to do it. But again, he's there and saying, we can't stop now. You have to find a way to do this. So that's why we're here today. And gratefully, and I'm very, very happy because a lot more people are aware, thanks to the pandemic, of homeschooling. And, because a lot more people are aware, there's a lot more interest. This year, we got about 300 registrations as against last year where I was like 100 and stuff. So it's progress, right? And I'm really, really glad that, these conversations are going on. You see different places where there are more homeschoolers and there are more people that are, talking about it, even if not putting themselves 100% into it, but they are, talking about it and they are making different changes in their lives and the lives of their children. So welcome once again to 2021 Homeschooling Conversations. And I hope and pray that this will be a very, very enlightening session for you. I know that our guest speakers were really handpicked to be able to give us information that we need to progress. And for all of us that have even been homeschooling before, to find a network of other homeschoolers so that we can all, continue the conversation and not be alone on the journey. So I would like to introduce our first speaker. Our first speaker is Anne Olowu, and I'm going to read a bio to us. I'm going to read a bio to us to know a little bit more about her. Dr. Anne Olowu graduated as a medical doctor from the College of Medicine, University of Lagos, and now has close to 20 years experience. She's a scholar of the West African Health Organization, ECOWAS, and USAID, where she had a postgraduate internship in reproductive health and HIV management. She's certified by the WIC Reproductive HIV and Research Unit, University of Witwatersrand, Johannesburg, South Africa, in HIV, sexual reproductive health and research. Furthermore, she earned a public health degree from the University of Manchester, United Kingdom, with special interest in global health and health promotion. She's an alumnus of the African Women Entrepreneurship Cooperative, AWEC, and earned 2 awards on completion of the business program. currently a board member of the Alumni Network. Dr. Ann's passion includes promoting health and total well-being of man, medical and public health experience in 11 African countries, where she continues to offer her expertise and evidence-based interventions. Dr. Ann is the founder and principal consultant at www.ID Consulting and a blogger at Moms24 on Instagram. So I will tell you the reason why I wanted to bring on Dr. Ann to speak to us today. Being a homeschooler, majority of the time you are with your child, you're with your children, you're with your child 24/7, and there is a huge probability of accidents happening. And it has happened to us in our home. It has happened to Dr. Ann as well in our home. And I feel that it is needed for us as homeschoolers, because we're going to be primary caregivers for our children and even parents in general, to have this basic knowledge of first aid. So she's going to come talk to us about first aid in the home. And I've listened to Dr. Ann speak a couple of times about public health and basically women's health in general, and I've always enjoyed that session. And I'm sure that by the end of the day, we'll be able to say that, we'll enjoy the session. And if you have any questions, please, the chat box is there. Please put your questions in there. After her session, we're going to have a Q&A. We're going to have a Q&A to answer your burning questions. So, with great joy, I would like to welcome Dr. Ann Olowu.
Thank you, Tomi. I am delighted. Can you hear me very well, loud and clear? Yeah. So I'm delighted, and I say a big thank you to you for inviting me, to speak at our very first session of the annual, because I call it now, it's the annual Homeschooling Conversations conference. So thank you for having me, and thank you to everyone who has logged in early and is joining us for the session. I trust that you're going to learn a lot from what we have to discuss, today. So I'll just go right in. Tommy, you haven't allowed me to. You have to allow me to share my screen so that I can get right into it. So while we are waiting for that, I just want to mention that, so the way I have tailored my presentation is to be able to talk about first aid, not just in the home, but, anywhere you find yourself. I mean, for you to be able to do first aid, if you are able to do first aid anywhere, then you are able to, do first aid in the home or outside the home. So even though the topic is first aid in the home, you will see that the way that I have done the presentation is to be able for everyone to be able to do first aid anywhere that you are. I believe you can all see my screen. Will this see my? Okay, you can. Okay, yeah. So I see people raising their hands. So let's get right into it, because we have a lot to cover, and I really want to try to cover it in less than an hour. So yes, thank you for the raised hand. So let's jump right into it. Yeah, I'm trying to, I'm using, I don't know why it's not. So I'm trying to use a PowerPoint and it's not, I don't know why it's not moving.
Remove it from full screen and see if it works.
Okay. Okay, remote control. Okay, it's asking me accept. It's asking me a bunch of questions. Okay, yeah, it's working now. All right, so let's dive right in, because we have a lot to cover. So I'm going to be talking along the slides, the topics that I have highlighted there. And so let's just go right in. What is first aid? Why do we offer first aid? First aid is the first level of intervention, that you're giving to anyone who you have found that is ill, or who has been involved, in a situation that is life-threatening. And what is the aim, of first aid? What do you want to achieve when you give first aid to anybody, whether at home or outside the home? The aim of first aid is to help to prevent, to preserve life, to prevent further damage or worsening ill health, or to promote recovery. Those are the reasons why we actually offer first aid care. Now, why is it important? Like I said before, it is important because you want to prevent a situation that has gone bad from getting worse. And not just from getting worse, from being the difference between, because your intervention can mean the difference between, a person surviving the incident and, being alive the next day, and saving, the loved ones of that individual, agony, and the difference between, having them alive and, resuming their normal life. So first aid is very important, and we need to really think on it seriously. So I hope we are able to get a lot from this session. Why is it happening again? Okay, I see. Okay, I guess I should just make away with the. Tommy, I think that the problem is because it's saying give mouse keyboard control to homeschooling conversations. So I don't know why it keeps happening.
I don't know how to do that.
Okay,
I'm giving you privilege, so
let me try. Okay, I see. I think I see the problem. I'm trying to. It's asking for, let me see again if it is going to work. Let me stop sharing and try to sort it out. Please give me a minute. Okay. I think it may not be, let me share again. Okay. Okay, it's working again, so I don't know what's happening. So sorry about that, everyone. I see that Hikmat raised her hand. Please, if you have any questions or any contributions as regarding the presentation, you may just leave them till the end of this presentation, and then we'll go right into it so that we can move very fast. So there are three important things that you need to do when you are faced with a first aid or emergency situation, whether at home or anywhere. First thing first is to do a quick assessment of the scene of incident to prevent harm to you and further harm to the victim. Now, I know that a lot of us, especially as women, we're always very quick. I know we have women and both men there, but sometimes women just react differently to first aid situations, especially if it involves our children. Sometimes we may not even think to just, to consider how safe it is for us before we intervene. Because remember, when you are giving first aid, the first thing that you should consider, because the aim of first aid is you want to preserve life, you want to prevent further harm, and you want to help to promote recovery. And so if the assessment of the area of incident is not safe for you, then you shouldn't put yourself in that situation, because then you'll be causing more danger, and we may end up having rather than one victim end up with two victims, and we don't want that. So assess the situation before you offer help. And if you see that, you know what, this is something that you can handle immediately on your own, the victim is out of a danger zone and you can go in, please do go in. Or if you see that you have to move the victim away from the danger zone and you can do it safely, then you can go ahead. So always remember, do a first aid, a scene assessment of your environment, and then always ask for help, always call for help. It is important that you call for help if you see that you would need help. And in most cases, when we need to offer first aid, we'll see that more often than not, we need help, because some of the interventions that you need to give may require more than just one person. And how do you cry for help? Shouting, the good old shouting for help, 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 help. It can go a long way in helping. Another thing that you can do is make a call immediately. Make a call to someone who you know that would help, that can help, who is available to help in whatever situation that you are. And then another third thing that I thought to add here is going live on social media. And I say this only if necessary. Why I say this is because we had scenario where people have no other means of finding help aside from going live and then able to garner attention, to themselves. A case in point, if you remember, this time last year, around this season last year, the NSAS event that happened around the Lekki Ikoyi toll gate, where, someone who was spearheading or was amongst, the people who were there, had to intervene with people who were shot, gunshot injury. And how did that help? The way she was able to get help was go on social media. People were able to advise how, to help people who were in need of gunshot wounds, telling them what to do. Hospitals were saying they were available. Hospitals around the area were able to say, oh yeah, bring this victim. And then again, beyond that, it was also used for, those videos, went on to be used in the court of law and, for other places, and helped us to trying to get justice for those who were involved in that situation. So that's why it is important that we always call for help. Now, the third thing that another important step in first aid is to ensure that you provide help to the best of your ability using readily available means. And then as we go along, I would explain why I say readily available means, and while ensuring that the ABCs of first aid are brought to bear. And I would go on to tell us what the ABCs of first aid mean as we go. But very key thing to note as a first aider in the home, outside the home, that you are giving first aid to preserve life, to prevent worsening condition, and to promote recovery. And then when I say the ABCs of first aid, I mean three things: the airway, breathing, and circulation. And then I'll go into more details as we go along. So let's get into the crux of the matter, talking about first aid care in different circumstances. And I have highlighted some of the ones that I think that are commonly experienced around the house and around us, and how we can handle them. So going first to bleeding, because a lot of times this is really common. A lot we have injuries that bleed. Our kids have injuries that bleed. Our family members have injuries that bleed. So what to know when you have abrasions or cuts? Important thing, first things to note is to assess the site of the bleeding. This assessment is important. We're always assessing, because when you assess, then it gives you an idea of how bad the situation is. You are deciding as you are assessing, you are in your mind, do you need to call somebody else to come and help you, or is it something that you can handle? And what are the things that we assess? We assess the type of cut it is. How deep is it? Is it skin deep? Is it just an abrasion? Is it something that can easily be managed, or do you have cuts that have jagged ends that are deep, that may need to be sutured in the hospital? Do you have debris or dirt, like broken bottle or all those things within the cut? That would also help what type of first aid or solution that you are bringing in the first instance. Another thing that you're going to note is the volume of the blood loss and probably the color, or let's say the consistency of the flow of the blood, the color and the intensity. I say this because, for instance, for a capillary bleeding, so we have different vessels or blood vessels. We have the capillaries, we have the veins, and we have the arteries. For capillaries, bleeding from capillaries will be very minute. I mean, they will just be dripping, and just you applying pressure on it is enough to stop the bleeding. Pressure for a minute or two is enough to stop the bleeding. But when you then go to venous bleeding, that means that you have had an abrasion or a cut that has opened up, part of the vein. Then you are going to see a lot more bleeding. And you should also always bear in mind that half a teaspoon of blood will look like a whole lot of blood when it is dabbed on cotton wool and when it is dabbed on tissue or it gets on the body, and so you may be alarmed in the first instance. This is not to say that you should throw caution to the wind, because any bleeding is something that you want to take care of immediately. But just to help us know that sometimes you see blood and you think, oh, it's a lot of blood, but really it's really nothing to panic on. It's something that really you can manage, in the home. And so when you see bleeding from capillaries and veins, it's not going to be a lot of blood. It's not going to be a lot of bleeding. You are going to be able to deal with it just by applying pressure. Now, the type of bleeding that that you certainly cannot handle, but you can control. I mean, you can still do something about bleedings from arteries. And usually bleedings from arteries are usually quite bright red, and a lot of times they are pulsating, so they can be spotting out, as the heart is pumping. You can be seeing them coming as pulses, and for those sorts of bleedings, a victim, if it is a large, volume of blood that is being lost, the victim can actually bleed out in a matter of minutes. And those ones are the ones that you really, really, really have to seek urgent help for and get them to the hospital. So what are the things that you do first aid? First, as much as you can, rinse off with very clean water, because you want to rid it of any debris that can stay in there, that can delay healing, that can delay clotting. So first things first, clean off the wound. After cleaning off the wound, apply pressure. Methylated spirit or not, whether you have it or not, it doesn't matter. The first thing that you must do is, at least if you have gauze, clean gauze, or cotton wool, apply pressure to the bleeding. And when you are applying pressure to the bleeding, what is it doing? It is helping to stop the flow of blood to the area, 1, and 2, it is also helping to activate even faster the clotting system, so that the body would naturally stop, the clotting and seal off, that area of clotting. So those are the things that you do when you encounter blood or bleeding. Another thing that you need to do is, if you see that it is a lot of bleeding, it's also helpful to lift that site of bleeding above the heart. So for instance, if you have a cut on the hand, you can lift it above the heart. If it is on the lower limbs or anywhere and it's a lot of bleeding and you are still trying to control it by applying pressure, you can just also always lift it above the level of the heart. And then, as I said, if it's minor bleeding, you can always cover it up. If it is, for instance, if it is on the leg or the hands where you have a lot of contact. If not, then you know that you can leave it open and then it would heal. But having said that, if it is the type of bleeding or the cut that you see that is very deep and needs to be sutured, then you need to get to the hospital. And may I add that for puncture wounds are like wounds or bleeding that you cannot really see the depth of the wound, and you don't know where the blood is coming from, and it is a lot of blood. That needs, as you apply pressure, ensure that victim gets into the hospital as soon as possible. Why? Because there may also be sites of internal bleeding where you cannot see, and that is a lot. And so you don't want to have the victim bleeding internally without you knowing. So I I go to nosebleed. I thought to mention nosebleeds because some people think that when you have nosebleeds, you can just lift and elevate the head and, the bleeding will stop. No, please, because the blood has to come down. When you lift the nose, then you are pulling blood up there, and that may lead to something else. And I thought to mention it because I hear a lot of people mention that, oh, I had nose, or my child was bleeding, I just lifted the nose. No, please, this is how you deal with nosebleeds. You apply pressure to the bridge of the nose, so much such that the victim is still able to breathe in air, or you may also tell them to open their mouth so that they can mouth breathe. And as you do that, you are applying pressure to that site of bleeding in the nose. Another thing you could do is use a tea bag. A tea bag, a lot of us have tea bags. When I mean tea bags, I don't mean, and I'm sure you know what I mean. I don't mean chocolate drink like Milo or Vomita. No, tea bags that, we dip. So you can just dip it in water, squeeze it, and place it firmly over the bridge of the nose. And that can help to, arrest the bleeding as you put pressure, and then encourage clothing. Another thing that you could do is just put a cold compress on the bridge of the nose. And that can also help with constriction of the blood vessel and handle the bleeding at the time. So moving on, we go to falls and fractures. And I'm going to spend some time talking about falls because a lot of us, some of us have stairs in the home, we have tables, we have dining tables, we have chairs that children can climb on and can jump from. Please, may I advise that if you have toddlers in the home and your toddler, and we know that toddlers are always very, very active. If you can avoid having a center table in your home, please do so. If you can avoid having a center table in your home. And if you have dining tables in the home, let the children know that it is a no-go area, because children tend to jump from heights. We've had children that will jump from tables and hit, sometimes they fall and they're okay. But unfortunately, there are times where, they can impact it. The fall can, they can fall in such a way that it has a bad impact on some important parts of the body that, can be damaged. So you don't want that. So avoid it as much as possible. Now, when you have a person fall in the home or anywhere, you want to quickly assess. Again, we are going to assessment of the area now. Assess the height of the fall. The height of the fall and how the victim fell. Did they fall with their chest? Did they fall on their backs or their shoulders or their legs? Because if you need further care and you need to go to the hospital, having that information would be able, that is if you were there, or you may ask the people who were there. That helps you to, for the type of treatment that you get that you offer for first aid, and then that you ask for in the health center. If you are able to provide the right information, then you are able also to aid the health provider with giving the most important care and the most important need that is required for taking care of that victim at that period. And so what are the things that you assess when you have seen someone has fallen? First, their level of consciousness. Are they awake? Are they aware? Do they know where they are? Are they okay? You ask, are you okay? Are you okay? Are they lucid? Are they aware? Or do they know you? That's one thing that you do. Do they have any swelling on any part of the body? You assess it. Any abnormal protrusions or deformities, because sometimes when there's a fracture, you tend to see that it looks as if there's a deformity depending on the type of fracture, especially for fractures that have been displaced. So I'm not trying to scale us. I'm just helping us to see the different things that can happen, and when you really should be considering going to the hospital immediately. Now, sometimes when people have a fall, they can have a spinal cord injury. And in such cases, you do not move the victim. At least you do not move the victim anyhow. For one to be able to move the victim, you have to be able to do it expertly. And I will get to that later. But first, if you suspect a spinal cord injury, do not move the victim. Why do I say this? I say this because a spinal cord injury may be temporal, but moving the victim and doing it wrongly may make it permanent at the end of the day, because probably, the moving of the victim has now caused more damage than good. However, you may ask, how do I know if it's a spinal cord injury? Yes, injuries that end up with the victim hitting their head on the floor, a head impact, a very bad head impact, injury to the neck, injury to the spine, or if the victim is complaining of very bad head pain immediately, neck pain, back pain, or for injuries where a heavy object actually fell on the individual, whether from the top or from the back. In those instances, one could, suspect spinal cord damage, and you don't move the victim immediately, except of course, the person is unconscious and they are not moving, and then you need to do a CPR, but we'll get into that later. However, if that is not the case, if the victim is conscious and they are okay and they are able to move their limbs, then you may put them in the recovery position. But now going to fractures. Now, if there is a fall or an impact and the victim has a fracture, how do you know that there is a fracture? You may not see any form of deformity around. The person may be able to move at first and then fall, or the person may not be able to move depending on where the fracture is. The person may have a lot, there will certainly be a lot of pain. The swelling may not be immediately obvious because it will start a little at a time, but the person will not be able to use that limb or do the normal activities. And what do you do? The aim is to prevent the fracture from displacing, because displacing the fracture would mean that the intervention for treatment may require surgical intervention, whereby they need to reduce the fracture or try to oppose it together, as against when everything is well aligned. You just put a cast on it and wait, depending on the site, 3 to 6 weeks or 6 to 12 weeks, depending on the site, for the wound to heal back. And so for fractures immediately in the home or anywhere you find, it's always best to splint the area. And when I say splint, what we are splinting is we just want to immobilize, we want to prevent that fractured part of the body from moving. And how do we splint? I'll give us an example. So in the picture that you can see, so this is a splint. And how can you splint? There are so many things that you can use for splinting. You could use cardboards. If you have cardboards, you can use newspaper stacked together. You can use towel. Just make sure you fold the towels very well and make them compact. So for instance, now we see a fracture around the ankle for the first picture. So the important thing when you are trying to splint a fracture is you are trying to avoid movement in the two joints of the fracture. So in this case, where we have a fracture of the leg or the ankle, you are avoiding movement. You want to stop movement around the ankle joint and around the knee joint. So ideally, this splint should actually get to the knee. And once you use the splint, whatever you are using around the home that is readily available, you can even use plastic, you can use wood, but whatever you use, make sure it's not going to cause any further damage to the skin or the wound around where the fracture has occurred. And then you can also use things like scarves, a bandana, a cloth, any twigs to tie the splints together. And when you do that properly, you will see that that particular area will not move. And then you can transport the person, to the closest health facility. Or if you have ambulance services, like some people have now, here, you can actually call for the ambulance until they come. And this, if you look down, this is how you splint a fracture that is on the upper limbs, that's the hands. This is for the upper arm and then for the forearm. And so I believe that this is explanatory enough for us, to know how to splint fractures easily at home and then get into the hospital, have it assessed, and then it can then be put into a cast. Now, I mentioned for when people, fall or lose consciousness and they are breathing well and their heart is beating well. And I'll tell us how to assess that as we move along. But I thought to mention the recovery position, because I think from what I had mentioned before, I had said that in the absence of a spinal injury, place the victim in a recovery position. And this is the recovery position. You will see 1, 2, 3, 4, how to place a victim in a recovery position, which you can do by yourself if you are by yourself. And the aim of putting a victim in a recovery position who probably cannot walk or who is too ill to stand, and because you want them to have their airway to be free so that they are able to breathe very well and air is able to get in, and so that as the heart is still pumping blood can circulate very well, and there is no and then also there is no chance of them asphyxiating. Now I'm using medical terms now. For instance, if they vomit, you know that they would not choke because of the way that you have placed them. And note that you tilt the head backwards, forward, and the hand that is closest to you is flexed. The legs that is closest to you is extended. And then when you go to number 3, you roll the victim close to you and extend, having done number 2 of extending the hand under the chin. And number 4, you place the victim as so. So that's the recovery position. It's really that easy. It's as easy as it looks, and it's life-saving as well until help comes or until you are able to move the victim to the hospital. So now let me go to bonds. Now bonds, we may take some time talking about bonds because bonds is very crucial. Like Mrs. Olatunde has said, as much as you try to avoid these accidents at home, sometimes they do happen, all right? And what are the things that you need to know when, maybe a child in the home or anybody in the home experiences bonds? I want to first talk about the classifications of bond, at least the major ones, for this conversation, the ones that we should know. The first, second, and third degree bonds. And I'll explain it. The first degree bond, these are the type of bonds that they have no wheels. There's just discoloration of the skin. So if it is a fair person, you might see a reddish discoloration of the skin. And if it is a dark person, you may see just a darkish, discoloration or purplish discoloration of the skin. And that easily can be managed at home, and I will get to how we do that. But for the second degree bond, this, best to take it to the hospital and have it checked. Now, a second degree bond would have a discoloration and would also have wheels. Wheels are wheels are like raised surfaces of the skin that look like they have fluid in them. Now you know that type of bond is a little more serious than a first degree bond. And then a third degree bond, and that is certainly a serious type of bond and would need not just hospital care, but specialist care. We need care from a bond specialist or a plastic surgeon. And really, it's a tough one to manage. And that's why it's that specialist care is required. Now, going to the types of bonds that require serious medical attention. And I need us to pay attention here, because some parents, some people believe that, they can treat bonds and it gets out of hand. So if you see that, any victim that you see or has any bonds in any of this region, please, it needs serious medical attention. And one is bonds on the face, and that's for obvious reasons. The face is like the mirror of a person, and if they have a bond and it's not well treated, it can cause disfiguring scars. So any bonds at all, especially a second degree bond, must have good medical attention. Then we talk of the groin, the buttocks, the hands, or the feet. Now this is also important because bonds in this area, if they don't heal properly, can be infected, and they can lead to sepsis. They can heal very badly and cause contractures. Contractures are like webbing of the area, and it really would need a lot of medical care and surgery to be able to care for a contracture. So it's best that the bond heals heals well, by primary intention, like we call it in the medical terms, without all the complications of contractures forming. And that's why it's serious and it needs serious medical attention. Now, bonds that cover a large surface area. When I mean large surface area, a large surface area of the body, that means it can be the chest, the face, the groin, all of it together, or just a large surface area. And why? Because we know that the skin is the largest organ of the body, and it has its own functions. One, it protects, it seals away germs from getting into the body. That is one, so it's protective. Two, it helps us in thermoregulation. So it helps to regulate our body temperature. And it's also in bonds, when you have bonds, the body also loses a lot of fluid. And so when there is a large surface area involvement for bonds, it can cause hypovolemia. That means that very low level of fluid in the body, in which case the victim will need infusion. So, when I say infusion, they would need to have drips to help to help to rehydrate them, and not just to rehydrate them, but they would also need some electrolytes. So that can only be given in the hospital. So that is important. Two, the hypothermia, the need that regulation. So a hospital where they will be well managed so that they don't go into hypothermic shock. And the third thing is the sepsis, to be able to prevent the wound from the bones from becoming infected, and which can lead to sepsis, and sepsis is really deadly, and that's why it requires serious medical attention. And then bonds caused by electricity or chemicals, really, because sometimes the damage they do is worse on the inside than on the outside. For instance, an electrical bond, you may not see such a bad bond on the outside, but it may have caused problems in the heart, to distort the electrical conduction of the heart. And that's why that also needs serious medical attention. And so talking about management of bonds generally, for bonds that, the things that you can do immediately before you go to the hospital, especially for starting from second degree bonds and first degree bond, of course, you place the bond area under running water for up to 10 minutes. And some would even tell you for up to 15 minutes, clean running water. And why are you doing that? Apart from cleaning the wound, the bond area, you're also trying to regulate, to bring down the temperature of the body. In doing that and running it under for that long, we are bringing the temperature down. Please do not apply ice packs, because if you do that, then you are exposing the body to another extreme temperature. So from very hot to very cold, and that doesn't aid healing. The best you can do is run under running water, normal clean water for that long, to help to bring the temperature down. And then two, what are all the other things that you can do? You can also apply, if you have pure honey, please apply honey. If it's pure honey, apply it on the surface of the bonds. Why? Because honey has antibacterial properties, and it also, because I don't have that in my slide, it has antibacterial properties, and it also has healing properties. So pure honey does that. Another thing that you can use is aloe vera. If you have aloe vera gel, fine. But I always advocate for us to plant aloe vera in our homes. I mean, you can even plant it it's a tough plant. It doesn't need a lot for it to grow. Once you put the soil, and from time to time you water, you don't even need to water it every day, and you put it under the sun, it is as good. And you would use it not only for burns, for cuts, for stings, for mosquito bites, and all of those things. You'd be able to use it. I know that I see Adekumbi's hand raised. Adekumbi, please keep your questions and your comments. We will take it at the end of the session. Don't worry. So we'll be able to, I was talking about aloe vera, and then you can use it for those. So you can also rub, and it is the pulp, the inside of the aloe vera now, the gel inside, that is what you use. So those are some of the things that you can use, as first aid for management of burns. And then we also have antibiotic ointment. If you have antibiotic ointment, use that. But most importantly, analgesics. That person would be in a lot of pain. For third degree burns, there may not be a lot of pain. And that is because, so the way you don't see pain, it's not the absence of pain, it's because the burns have been so bad that they have eroded, the sensitive area. Some of the nerve endings have gone. And so the victim may not be feeling pain. It doesn't mean that is not a sign that it is not, the burns are not very bad. So in fact, for that, you have to even be more cautious and ensure that the victim gets to the hospital immediately. And so says, yes, so give analgesics because of the pain from the burns, and then seek medical care and go to the hospital, particularly if it is a second degree burn. So moving on. So I've talked about the other things I have on the slide, but just to quickly hammer on the need for prevention, because in my home, it happened while I wasn't in the home, but at least my minder was very careful, and it took a split second. And so, and even for Tommy's story too, when her son had it, it took a split second, because we know how toddlers are. I mean, something distracts you, or you want to try to do something the next minute, and before you know it, the deed has been done. And so we can still try our best, better to err on the side of caution than to throw caution to the wind. And how do we do that? When we have toddlers, let's limit their presence, their entry into the kitchen, especially when cooking is going on, and especially when a lot of cooking is going on, because then your attention may be divided. So try as much as, but I know that for some people, they have no help. If you are backing the child, make sure that their hands are tucked inside, so that they don't try to grab anything if, you have to take them into the kitchen. But if you don't, then please don't take them into the kitchen. That is one. Two, let's try as much as possible when we are cooking, the edge of our pans. For instance, for example, for frying pans and all those pans that have very long handle, always be aware when you are cooking, ensure that those handles are tucked inside and not outside. Because you who is cooking, or if you have someone assisting you cooking, they may hit their elbow on the edge of the pan. You may hit your hand on the edge of the pan. That may cause trouble. So you want to always avoid that and ensure that, the edges of the pan are always tucked inside, in the farthest place where your hands cannot reach it. And then may I also talk about hot water, because I know we have electricity issues, at least if you're in Nigeria. We have electricity issues, and sometimes your heater may not work, and you may need to if you want to have a hot bath or have, give your kids a shower, you may need to transport hot water from the kitchen to the room. This is what I always advocate. If you have toddlers, have someone hold them. Have someone hold them while you transport that water. If you're unable to have someone hold them and you are by yourself, if you can lock them up in a room, for it's just a split, it can't be more than a minute or two. Lock them up and do the transportation of the water from one room to the other, if you must. And when you are doing the transferring of water, hot water or hot substances, please always make sure you don't use buckets. Don't use buckets. Don't use bowls. Those things that are open, don't use them. You are better off leaving them in their kettles, in the kettle. You carry it in the kettle. But what you should do is ensure that it is not spilling over. If it is spilling over, pour some out, because you also want to avoid you being burnt. And as you are carrying it, as you have locked them up or have someone handle them, you have to still be announcing, I'm carrying hot water, please avoid me. I'm carrying out, don't come near me, don't come near me. It's as simple as that, but it can be life-saving. And I always say, never leave children unsupervised where hot and harmful substances are nearby. I know that sometimes it happens, in a flash, but as much as you can prevent it. I mean, you don't want to see the agony of seeing your child in pain. Burns really cause a lot of pain, it causes a lot of pain, and it can really be disheartening. And it takes a lot of time, to heal. So you want to avoid it as best as you can. So moving on, I go on to choking. Now, choking is a life-threatening incident. It can be, it's not that it can be, it is life-threatening. Why is choking life-threatening? It is life-threatening because when someone is choking, they cannot breathe. And so they're not even able to talk. They're trying to cough. If someone is able to cough, then you know that, oh yes, the person is being relieved. But if someone is unable to cough or talk, and they are like having their hands on their neck, or they're trying to find attention, then you know that this person needs urgent intervention. And why? Because when someone is choking, it means that something has gone on to block. You know that our esophagus and our throats. Yes, that's what I mean by esophagus. Our throat and our trachea, they are interlinked, but there's a way the body works to close it when we swallow. And sometimes when we are talking or when we're not paying attention, the food can go in the wrong way. And when it goes in the wrong way, what has happened is that there's something blocking the trachea. That means that the part of where air is supposed to go in. So the victim is trying to breathe, but the air is not going in because something is blocking the windpipe. Something is blocking the trachea where the air will go into. And so that's why they need help. And if they do not get help, or if that object blocking the trachea is not dislodged, in another four minutes, the victim may go unconscious. And if nothing is done, the person can go in an instant. So this simple Heimlich maneuver that I'm just going to introduce to us is life-saving. And what do? Simply, if you can see my hand, is by forming a fist. And if by forming a fist, if you see when you form a fist, your knuckle is out there, your knuckle is out. And that means you're standing behind the person. As we can see in the picture, I think it's self-explanatory. You form a fist, put it right above the belly button, and then take your other hand and hold it like this. That you're standing behind the person and you have your hand around the person and you're holding it and you are above the belly button, and you go and you hit the person inside, in and up, in, up, in, up, just like that, just as simple as that, and doing it repeatedly until the object is dislodged. And if unfortunately you get there, you intervene too late, or you just happen to be there when the person is just about losing consciousness and you know that the person was choking, then you need to do a CPR. And as you're doing the CPR, it can also help to dislodge. Why are you doing the CPR? So that even though air is not going in, at least the heart can continue to beat, and you can also give the person rescue breaths. And I will get to that when we get to loss of consciousness. So I'm going to play a quick video for us to see how to do a Heimlich maneuver outside what I have, outside the pictures that I have added. So let's take a listen.
You need to know if you find a person choking. This is Choking Charlie. He's going to help me with the demonstration. The universal sign for choking is the hands crossed at the neck. If they are coughing, then they are able to breathe, and you would not perform the Heimlich maneuver on them. In order to do this, you stand behind the person and make a fist with your thumb pointing back against you, midline between the belly button and the rib cage. Grasp that fist with your other hand and pull back and up quickly until the object is expelled or the person loses consciousness and needs to be lowered to the ground to begin CPR.
I believe that was self-explanatory. It was explanatory enough. So it's that simple. So if you feel that you don't have enough of it, you can just go to on YouTube and just Google Heimlich maneuver. But if you do it to someone who is not choking, to see how serious, how effective it is, and they have just eaten, they can actually vomit on you. So while you are practicing, bear that in mind. You don't want to do it too hard, because if they don't have, they can actually vomit. Now, to do a Heimlich maneuver on a child is a little tricky. Now, for children, for older kids, you can do it the same way that you do for an adult. But for an infant, because they are younger, the technique is just about the same thrust, but it's different. And unfortunately, I wish I could do a because we have the mannequin, the baby mannequins that we could have used, but I mean, it goes beyond the scope of this presentation and to take all of our time. But I brought out this pictorial demonstration because I think that is explanatory enough. And how do you know when an infant or a baby is choking? They may have trouble breathing. Sometimes you will see around them that they are playing with things that they should not have been playing with. And so that is another cautionary note for us to know that, look, you shouldn't leave things, that objects that, you know, can cause choking around children. And they will have trouble breathing, they can't cry, they can't make sounds. What do you do? Or when you see that, when you actually see that, you know, they've had something in their mouth and that can cause choking. In fact, things like groundnuts can actually even cause groundnuts, chin. There are things that we should not give children. I know sometimes it can be tempting to, if you have to, then you have to cut them in very tiny bits, because if it goes in the wrong way, as small as it is, whole groundnuts, it can cause choking for some children. So what do you do? Because they are infants and some of them may not have neck control, or you may be trusting so hard, you don't want to injure their neck. And that's why when you look at number 2 and you see the way the demonstrator is holding the baby, the neck is being supported, you know, they're holding like this. And you note that the hand is open like that and it is not covering the mouth, because once you are trusting, you want to see that the item has been dislodged. So the mouth must be open and you must not be, you know, blocking the mouth. And you also have to be careful not to where your fingers are. If you look very well, you will see that it's just around here in the picture, because their eyes are there. You don't want to poke their eyes as you're holding them. And then you are resting them on your lap and holding them like so. And if you see that purple area, that is the area where the thrust happens. It is in between the 2 shoulder blades. So at the back, in between the 2 shoulder blades, the thrust can be given there, and you do it 5 times. 5 times. And as when you do it 5 times, if the object has not been dislodged, as you turn them, check their mouth and see if it's there. And then you turn and then you give 5 chest thrusts. And those chest thrusts are CPRs actually that you do. And why do you do that? Because you don't know for how long, if the child is losing consciousness or the circulation is not going well. You just want to take care of that because they are babies. And so as you are doing that, you are not also only helping to dislodge the substance that is causing the obstruction, but you are also trying to get the heart pumping so that the child doesn't go into lose consciousness, or even if the child has lost consciousness, at least you are trying to revive them. So that is what you do for a Heimlich maneuver for an adult and for a child. And so you repeat it until it is dislodged, or until help comes, or until you get to the hospital. All right, moving on quickly. Poisoning, I see that our time, we've almost been here for close to 50 minutes. Poisoning and inhalation of toxic substances. I thought to add this to this presentation because sometimes a lot more harm is done in trying to arrest the situation. And the things that parents do when, you know, children take poisonous substances are the things that actually end up harming the child or killing the infant. A case in point is sometimes when people forcefully give palm oil to children who have taken toxic substances, because they believe that the palm oil would prevent the absorption of the toxic substances. Please, the things that you do when you notice that a victim, the child or an adult has taken a toxic substance, don't force them to drink water. Don't force them to drink oil. What can help at home as first aid that you can give is activated charcoal. Now, activated charcoal is not just any charcoal that you see around and you blend it and then give. No, activated charcoal, you would actually see them in pharmacies. So you can actually buy, and it's not only used for poisoning, it's also used for other things. And I'll get to that as we move along. So you can always get activated charcoal and give it as first aid, while you also get that poisonous substance that the victim has ingested. Take it along with you. And as you are going, anyone who is around can be, investigating on the substances, of the poisonous substance, of the components of the substance that, the victim has ingested. So the first aid that you give is not to induce vomiting, because again, some people will try to induce vomiting. Vomiting can be dangerous because depending on if it's a chemical or if it's a substance that, in forcing it out, it can also burn, the alimentary canal, the esophagus and part of the stomach. You're causing more harm, than good. So give activated charcoal if you have. If you don't have, go and get it and keep it in the house. I'll tell you some other things that it can be used to. And again, as I always say, always prevent exposure to poisonous substances. And how do you do that? Please do not put poisonous substances or things that cannot be taken in water bottles. Please don't. Don't put them in water bottles. Don't put them in fizzy drink bottles. If you must put it in a bottle and it's not its container, look for an ugly one, the one that does not look nice, the one that is old and rugged. And if you don't have any choice and you must use a water, please label it boldly and make sure it is not in anywhere where a child, where a minor, or even an adult, except you who knows what is there and you have labeled it, knows where it is. So better to err on the side of caution. And in instances where it is an inhalation, that is, they breathe in toxic substances. And I say this because we have incidents of generator fumes. People have inhaled generator fumes and they are losing consciousness, and you get in. The first thing you do is get them out of the environment immediately. Get them to open air where they can breathe in air. And if you see that they do not have they are not breathing or they have lost consciousness, if they are not breathing, you also want to give them rescue breaths. And what are rescue breaths? It's just you breathing, taking a breath and closing their nose. You will pinch close their nose. Why? Because when you give them the breath, you don't want it to come out of the nose. You want it to go into the lungs. So you pinch their nose and you tilt their head up and you have a jaw thrust, and you taking a deep breath and you cover their mouth with yours and give them the breath. Basically the breath of life, and you instill the breath of life into them, and you do that twice at the same. So you give, and then you take in the breath of air, you pinch their nose, and you give again. And as you are giving, you are watching their chest to be sure that the air you are giving is going in and not coming out. And if it is not a close relative and you don't want to, or you're not comfortable giving mouth to mouth, of course, if you're a health practitioner, you would probably have a mask or the resuscitation masks that can be used. In the absence of that, you can use a handkerchief. A handkerchief is good enough. Put the handkerchief over the victim's mouth and, give the air and haven't covered the nose. Or if you see that the victim is also totally unconscious and has a weak pulse, and I'll go to loss of consciousness, how to do a CPR as we move along. So let me just quickly go on to seizures. I thought to mention seizures in our first aid because we also see people having seizure disorders. Some people have epilepsy, and a lot of times people are confused as to how to manage it. And sometimes for people who have toddlers in the home, it can be from a febrile illness. When I say a febrile illness, I mean fever. And I would also get to, I know I think we're running out of time, but for seizures, first thing you want to do is to ensure that, don't try to stop the person from having the fit. The fit has started and it will end on its own. There's nothing you can do at that time that can stop the person from completing that seizure episode. So what you do is manage the environment that the person is. So if you see that, there is danger around the person, remove hard objects that can harm the person. Tables, chairs, any object, remove it. If you see that the person is, jerking towards the area where they can fall, move them. In that instance, you can move them away. But importantly, please don't put anything in their mouth. Some people say, they put objects in their mouth, they put spoons or objects so that they don't bite on their tongue, or so that their tongue does not fall behind and cause choking or asphyxiation. Please, you will be doing more harm, because those objects that you're trying to put may actually be the ones that will cause choking and go in the wrong places, or they can damage their oral mucosa and make even healing more difficult for them, as they have to take their drugs. So manage the environment. If you can time the seizure, time it so that you know. If you can describe it, take notes. Or another thing you can do is to do a video recording if you're more than one. To do a video recording of how the seizure is happening, so that when you get to the hospital and you're trying to get care, you can show the health professional and they can know exactly what type of seizure it is, because there are different types of seizures. There's the tonic seizure, there's the clonic seizure, there's the tonic-clonic seizure. So there are different types. So that's why it's important. And yes, so that's how we manage seizures. So let me quickly go to the next thing. Yes, the big one, the loss of consciousness. I mean, when we began, I said we start by assessing the environment for the safety of the victim and for our own personal safety, and we call for help if necessary. And a lot of times for loss of consciousness, you would always need help because why? Because the type of intervention you may need to give may be too cumbersome for you alone, especially if what you're offering is first aid and you're not trained in CPR or expert care. So what are the first things that you do? Is the person losing consciousness and gaining it, or totally out of consciousness? So you want to start by asking, how are you? Do you need help? Do you need, when you see that they are not responding and you have touched them and they are not responding, what do you want to go next to check? ABCs of first aid, the airway, the breathing, the circulation. How do you check the airway? Is anything blocking them from breathing in very well? And don't forget the recovery position. Remember that we said the recovery position may be used for someone who is breathing well and who, you know, has their heart is beating well from checking the pulse rate. So if the person, is the person breathing well? If the person is not breathing well, is anything blocking, you know, the airway? No, have they vomited? Are they choking on their vomit, or are they salivating? You want to check all of that. If the person is struggling to breathe, then you know that there's problem with the breathing. If the person is unconscious and you can hear snoring, then there's something blocking the airway. Doesn't mean that, and you know the person is not sleeping, then something is happening to the airway, you know, or you hear different sounds, or you labored breathing. What are the things that you can do? Rescue breaths, like I said, those rescue breaths that I have talked about. And then how do you also access for circulation if the heart is pumping blood well and the electrical conduction of the heart is at par with the way it's conducting well? Some of these things you may not know, but what you need to know is you can check the carotid artery. And when I hope you can see, if you check your neck, you will see that there is a triangular area in between, you know, the middle part of your neck and the side of your neck, that triangle there. If you dip your hand in deep enough, if you dip your hand deep enough, you can actually feel the pulse. Can you all try to do that? Can you feel yours? Tell me, can you feel yours? Yeah, so that's it. So usually for people who have lost consciousness, if they have a weak pulse, you will barely feel it. Or if they don't have a pulse at all, you will not even feel anything. So it is important. So when you see that and you know that, then you know that this person needs CPR immediately. And what is CPR? It's called cardiopulmonary resuscitation. And what is the essence of it? You know that the heart is like the pumping machine of the body. So the heart pumps the blood to take to every part of the body. And that pumping machine of the body, which is the heart, it just doesn't pump blood. It also pumps the oxygen, the air that you take in, and other nutrients to all the cells, the tissues, and the organs, and everything, you know, of every part of the body. And so if after a certain period, the heart is not pumping, then you know that blood and oxygen and nutrients are not getting to all these parts of the body. And that is danger. And that means that the victim is sleeping away. So doing a CPR, you are trying to help the heart to do its work. And that's why CPR is essential. And in fact, in recent times, they say you may not need to do what's it called now? Give rescue breaths, the breathing, the two. Just go on and do a CPR. And so that helps with circulation. And then for the fourth one, the D is, we have D, we have E. But for main first aid is A, B, C. D is for deadly bleeding or defibrillation. So deadly bleeding is the victim bleeding. That's why I say you would need more than one person to help someone, especially if they're unconscious, if they've had an injury, they are bleeding, you want to take care of the bleeding and stop it. And defibrillation is for people who are trained in CPR. They can use a defibrillator while they are also after doing the CPR, because then it can tell them, oh, okay, this heart can shock and get the victim back. But in times when you do a proper CPR, you can actually get the person back into consciousness. And there are a lot of testimonies to that. So let's see how easily we can do a hands-only CPR from this video.
If you see a teen or adult suddenly collapse, it's important to act fast. Helping to save a life is easier than you might think. Just start hands-only CPR. The first step is to send someone to call your local emergency response number or call it yourself. Then get directly over the victim. Put the heel of one hand in the center of the chest, then put your other hand on top of the first. Then push hard and fast in the center of the chest until help arrives. It's important to push, giving 100 to 120 compressions per minute, which is about the same tempo as this song.
Yeah. So I hope that is explanatory enough in terms of giving a CPR. It's a more specialized training that we do, for you, where you can have a hands-on. But just simply knowing this, you can also watch videos on YouTube and see and learn how you can do simple CPRs. These things are actually life-saving. And as I said, what you are doing is you are helping the heart to do its work. If you are doing it efficiently, it can actually help the person even to regain consciousness. So let's go, as we are going towards the end now, your first aid kit. I know a lot of people are looking to know, what do you put in a first aid kit? What should you have in a first aid kit? Now, in having a first aid kit, you don't have to go and buy an already made first aid kit. You don't have to. If you want to, it's okay. But you can make your own first aid kit. All you need is a container or a bag or somewhere in the house where you keep your first aid items. And these are some important things that you need there. If you have a toddler, for instance, you must, if you have young children, it's a must that you have a thermometer. Why? Because a thermometer would really help you to know when a child has fever. And there are certain fevers that you do not joke with, that, once it is beyond 38 point something, is hitting 39, you want to be tepid sponging and giving analgesics. And I'll get to the type of analgesics that we can give when we have very high fevers, because some bacterial infections and viral infections can really have very high spikes of temperature, which needs to be brought down quickly. And so that's an important thing to have. Then, of course, you have bandages, you have scissors, you have antiseptic wipes. I have also put there a pulse oximeter, especially in this season of COVID. A pulse oximeter is, you wear it in the finger, and it's the one on the top corner there, top right corner for me, or probably, on the top right corner of the screen. You see it is important because it checks your heart rate, your pulse rate, yes, which also can also be your heart rate. It checks your blood pressure, and it also checks your oxygen level, the oxygen. So for people who have, for children and adults really, who have upper respiratory tract infections, or who have asthma, for instance, it helps you to know how much air is getting in, if you need to take that victim immediately to the hospital. That's why it's important. I know that I also mentioned activated charcoal. Apart from the fact that activated charcoal can be used as the first line of treatment for management for poisoning, it's also used for diarrhea, especially for adults. What it does is it can help to mop up, the bacteria or the virus causing organism that is causing the diarrhea. And so it's something you certainly should have in your first aid box. And then, of course, we have the gloves, we have the tweezers. Now, tweezers are good for you to have because they can help you remove splints underneath the nails, underneath the skin. So that's why that is important. Then I go to the drugs that you should have in your first aid kit. Different types of drugs. Analgesics, you should have ibuprofen and paracetamol. However, when we are dealing with pain, let us always start with the lowest one first. You always start with the paracetamol. Don't use a sledgehammer to kill a fly. So start gradually. The reason why I say ibuprofen is important is because when you have children with high, or even adults, will have high fever spikes. So ibuprofen is quick acting, but it's also it has a quick onset of action, but it's short acting. That means it will start its work fast, but it will wait in 4 to 6 hours. And so if you need to bring the fever down with your tepid sponging, you can give ibuprofen at first. And then after 4 hours, you can then give paracetamol. That one is long acting, so it can last for up to 8 hours before you need another intervention, until until you have to take the child to the hospital. But don't always wait to get to the hospital before you intervene when a child has fever. And the reason is because you don't want them to have a convulsion, a febrile convulsion. So that is why having that is important. So from analgesics, I go to ORS for diarrhea for children. You should always have the ORS solution ingredients at home, and zinc as well. Another thing that you can use for first aid for children when they have diarrhea, if the child is breastfeeding, please continue to breastfeed, don't stop. Other things that you can give for other children and adults, you can give Gary water. Gary water has electrolyte. It will help to not just give the water to replenish the taste, but I think it also has electrolytes that it gives the body. The same goes for coconut water, and the same goes for rice water. Those things you can also use as first aid. And I've also mentioned that we must always ensure that we have aloe vera in the home. Then another thing for drugs that you must have are antihistamines for allergies. Especially if you have children who have allergies, you should have, even because of colds and catarrh that children have, it's also always good to have them at home so that they can sleep better and breathe better when they're having those episodes. Another set of drugs that you must have, if you have an asthmatic in the home, you must always have Ventolin inhaler. You must never run out of it. So your home, your first aid box is also dependent on what is common in the home, the drugs that you have. If you have someone who is hypertensive, you must always have a refill of hypertensive. If you have someone who is epileptic, for instance, you must, or whatever drug you always have, make sure that you don't run out of it, aside the other regular ones. Now, for antibiotics and antimalarials, I don't always advocate that we have them in our first aid box because we tend to abuse them a lot. The person may have maybe upper respiratory tract infection from a virus, but we think, oh, it's a bacteria or it's malaria. And we really, really misdiagnose a lot. And because of that, I wouldn't advocate that we have that. But all other things, and then as you see in the drawing, we can have in our first aid box. So in rounding off, I want to remind us of the key points, the 3 Ps of first aid. If you can remember, let us say it together, the 3 Ps of first aid. Why do we intercede? Why do we give first aid? Because we want to preserve life, because we want to prevent worsening, disease, illness, or progression of the incident, and because we want to promote recovery. And let's not forget the ABCs of first aid when we're giving first aid and the person is unconscious: airway, breathing, circulation, management of deadly bleeding, or defibrillation. Let's forget the defibrillation. Let's go with the management of deadly bleeding. And then don't forget that you must always ensure that you do not put yourself in danger while helping others, and always ask for help when necessary. And I have thought to also share with us the hotlines for emergency services in Lagos. I tried to look for the whole of Nigeria, and I'm sorry I couldn't find, because I know we have viewers from across, Nigeria and even across the world. But this is my local environment, and I was able to get, and you will see we have for COVID, we have for ambulance services, which actually works. We have for fire service, domestic abuse, police, and all of that. So I know that at the Cuddle Block can share that with you later on. And in closing, I want to say, prevention is the most important factor in health and safety. And a culture of prevention, I'm a prevention advocate too. A culture of prevention will prevent a myriad of accidents and injuries. Thank you for listening. And that is it. So I will take your questions now. So over to you, Tommy, rather. And thank you. And I hope that this session has been most useful for
Yes.
you all.
Yes, yes. If I've mentioned the comments, that it's very informative, very informative. Wow, that's so. I've always listened to your presentations, and I'm a big fan because I always learn something, even if sometimes it feels like, oh, I know some of the things, but your sessions are always, always informative, and I really appreciate you coming to us today. So if you have any questions, so we have 2 questions here now. So in the situation when activated charcoal isn't available, what else can be done?
My advice, because you don't know what that ingredients, what the poisonous substance can do, best just get the victim to the hospital. Don't try to give them water. Don't give them oil. I say this because when I was actively working in the hospital, we had a patient who had tried to take his life and had taken, I've forgotten what he took now. And it was in the early 2000s. And in trying to get the substance out and in trying to induce vomiting, the victim actually lost most of his esophagus. As in, when I say esophagus, that's his throat, because it was now burning all the way up and it caused a lot more damage. So don't. And then we've had children in the emergency ward who were brought, maybe they took kerosene and or whatever, all these substances. And the parent was trying to give them palm oil. And they succeeded in giving palm oil. But unfortunately, they force-fed the palm oil. But you know what? It also went the wrong way and it caused asphyxiation. And the child, and it's not one child, because I've had pediatricians talk about it over and over and over again. The palm oil that they gave, the first aid treatment that they gave was actually what killed the child and not the poisonous substance that the victim took. So for me, I would always say, but what you should do now that you know, from here now, you know that activated charcoal can do something. So go on and buy activated charcoal from the pharmacy and put it. As in, when I bought it, was very cheap. It's not so, it's not expensive. It's something that you should have. So just have it there at home. That is what I would answer.
Okay, so second question, is there a specific brand of ibuprofen recommended or just anyone you do for children?
For children, any brand? No, I can't. Any good brand of ibuprofen that you use is just as well. But don't forget that I said that ibuprofen should not be your first line of treatment, except when you are treating very high fevers. And when I'm saying very high fevers, you are looking at the thermometer and it's reading 39.5, 39.6, going towards 40. That means you're already tepid sponging, you are exposing the child, you are tepid sponging, and you are giving ibuprofen, and then you interlace it. After 4 hours, you give paracetamol, and after 8 hours, and you keep watching the temperature reading to be sure that, from time to time, that you are actually bringing down that high fever, that fever, you're actually bringing it down. That high temperature is coming down, as you make your way to the hospital. Or if you've already been given medication and the temperatures are still in the highs, then you can use that mix of ibuprofen and paracetamol. But I can't recommend any specific brand, for us.
Okay, so next question, is activated charcoal same as Akoro used by Yoruba mothers? I don't know if I call this like that.
I don't know. I don't know what that is. But to get real activate, I don't know, because sometimes we have these traditional remedies that are actually similar to what we know in the medical terms. But I'd always recommend, because you also need to give the right volume, so you don't overgive and you don't undergive. And if you have the proper, the real activated charcoal, the instructions are always on the container of how to give it. That's why I would recommend that you get one from the pharmacy. and you follow the instructions there.
Okay, another activated charcoal question. Can activated charcoal be given when the child with allergies takes an allergen?
When the child is what?
With allergies takes an allergen.
No, I didn't get that.
Activated charcoal is given when a child with allergies takes an allergen.
Oh, it takes an allergen. No, the best thing to do there is to give antihistamine. Okay, those are your Piriton, but you know you will not get Piriton in Nigeria now. I'm not sure you can get it off the rack, but there are some other brands that you can, of antihistamines that you can get off the rack. And I'm not sure I mentioned, I think I mentioned that antihistamines are important for you to have in the home, even for treating colds and common colds, just mild colds and all of that. So when a child has an allergy, give an antihistamine, not activated charcoal. Activated charcoal is for poisoning, you know, and for diarrhea for for adults, you know, or older children.
Okay, next question. You did mention dairy water. Do we add salt and sugar or just dairy and water?
Okay, well, so in adding salt and sugar, we know that then you are bringing the component of ORS. And if you are adding it in the right proportion, I don't see anything wrong in that. But just giving Gary water is very helpful, both for children and adults, you know, because it helps you to replenish. So whichever way you do it, it's okay, I suppose.
Okay, so rice water.
Yes, rice water.
Just soak in water, or for how long would it be soaked? The rice water.
These parents, they are very, very, I don't know for how long, but I know that it's always recommended. Haven't washed it. Some people actually keep just having, you know, like when we want to wash rice, when we are washing rice, you know, as you wash, you can see so you first wash off the dirt part, and you can now, you know, when, you know, they say sometimes we parboil rice, so that water you can save that parboil, so that you know that you are not bringing in any other contaminant from the rice water. The boiled one, you can cool it and store it in the fridge, you know, so it's not just staying overnight. You don't need all of that. Just that water that you parboil in rice is good enough. Okay,
so last question. If my infant chokes on water or any edible liquid, do I let her cough it out, or do the procedures you described? You're choking on water.
Sucking on water. Oh, okay.
Yes.
Oh, okay. If no. For choking on water, just let them keep coughing. You know, as they cough it out, you know, once someone is coughing, then they are not choking. They're okay. Once they are coughing, that means that they are able to get that thing out. So if all of you are eating now, somebody is choking on something and they are coughing, you know, the cough is the reflex action to get it out, then they are fine. Just let them cough it out. Don't try to give them, just let them cough it out and they'll be fine. But if it now degenerates and they're not able to cough, they're not able to talk, then you know you need to intercede. But for water, usually they'll be okay.
Okay, so says how many times can I give ibuprofen in 24 hours? Did you get that?
Okay, so a lot of times, the instruction, I don't want to give prescription now because we are because it depends on what the victim has. And remember that I said this is first aid. Don't go and be treating fevers at home, because a fever is, don't go and just incessantly just be treating the fever, because the fever is not the problem. Fever actually is helpful for the body. It's the way of the body signaling that, you know, something is happening and I'm dealing with it. So fever, actually, it's a good thing. It is when it gets above that figure, when it's getting close to 40 degrees Celsius, that can cause a fit. And you don't want it to get there. That is why you will take each sponge, and that is why you need quickly to act fast so that the fever does not progress to that level where it begins to affect the brain and thermoregulation and distorts things and cause a fit. So what I advise is, once you have given 3 doses of it interlaced with, paracetamol that you've given after 4 hours, we have 24 hours in a day. So the first 4 hours, the ibuprofen has worked. The next 8 hours, paracetamol has worked. You've given paracetamol. That is already 12 hours. And you give 2 more doses. Then, and the child or the victim is, the fever is not dropping at all. The person is not getting better. Then go to the hospital immediately. And go and figure out and find out the cause for the fever. I hope that answers the question.
I hope it answers the question. Yes, that's all the questions that we have. Thank you so much.
Okay, so I see the question now. Paracetamol causes vomiting for me and my older child. How many times can I give ibuprofen in 24 hours? I'd say don't do more than 3 times, and make sure it's not done. You can do between 3 to 4 times, really, but make sure it's not done on an empty stomach, because over time, ibuprofen is a non-steroidal anti-inflammatory drug. And for some people, it can cause gastric erosion and can predispose some people to having ulcers. So I wouldn't say that, don't be quick. For me, in my home, I don't use ibuprofen except when I'm talking about very high fevers. I always first would use paracetamol than ibuprofen. But I get it that, for some people, they can't tolerate paracetamol. But also, may I ask Oluwa Fumike that it also may depend on the brand of paracetamol that you are buying. Okay, there are different types of paracetamol. Some of them are like capsule shaped. They're not in capsule, but they're not the round ones. Those round ones can, really be irritating and elicit vomiting. But those capsule-like shaped ones are easier to swallow. And you may want to try that, And then for the child, for your older child, they are different. I also noticed, because for my kids as well, I noticed that there are some paracetamol brands that they can't tolerate. So they are different. Some are very, very bitter. And then some of them have been slightly sweetened. So there are different types out there. So before you say that you want to ease out paracetamol totally, try the different brands that are available. And you may just, find one that your body and your child can tolerate.
Okay. I hope that answers the question. Okay, so let's take this last question. Please, how do you treat bleeding in the mouth from falls? Muted. You're muted.
Okay. Yeah, thank you. It's important to know where the bleeding is coming from, because I had a personal experience with this. My son fell from a height. It was the scariest experience of my life as a mother. And yeah, it was a very bad fall. And as we brought him out, he was at first he was confused. So when we're trying to assess his level of consciousness, and it took a while for him to come to himself. And I totally lost it when I saw blood coming from his mouth, because I think he landed on his chest. And so he landed on his chest. And I was already thinking internal injury and all of that. And so the first thing you do, you assess it. And then suddenly we saw that the fall, the impact, he lost some of his tooth, and the impact of the fall also gave lacerations in the mouth. So you want to assess where the blood is coming from. Is it coming from the mouth, from the oral mucosa? Because those can easily bleed a lot. If you bite on the tongue can bleed. So you check. If you've had a fall from the mouth, a fall and the child is bleeding, bringing out blood from the mouth, you first want to be sure that it's not coming from coming from inside. So if you check around the mouth and you see that it's blood from the mouth, you can get them rinse the mouth. But if they begin to spit or vomit blood, please, that needs to be taken to the hospital ASAP. Yeah.
I hope that answered the question. So thank you very much, Dr. Anne. And I know that it was a very insightful one because I learned a lot as well. I've taken notes. Hope you also learned a lot from this session. Thank you so much, Doctor.
Yeah, you're welcome. It was my pleasure. It's my pleasure. It was my pleasure.
So yeah, we're quickly moving along. Oh, question from YouTube. Wow.
Okay. Okay.
I forget that there are people that are on YouTube. Okay, we've answered that. Okay, we've answered most of the questions from YouTube.
All right.
Okay. So the same activated charcoal. Is it the same ones that they use for skincare? Is it the same ones?
Some people use it for skincare, but just make sure that the label says activated charcoal. Not for cosmetic reasons. Some, there's so many things that activated charcoal is used. Some use it for teeth brightening, for so many things, that activated charcoal is used for. So yeah, it's okay.
Okay. Yeah, and you said what the measurements? I don't know. The measurements for the activated charcoal.
Yes, and that's why I said that it's important not to just use any charcoal, use activated charcoal, because different preparations come differently. Some come in powder. The ones I know, they come in powder form. So on the bottle or the container, the description is there. How many to use, how many teaspoons to use, and for sometimes, the type of intervention you are using it for is also described. If you're using it for poisoning, so amount of teaspoons. If it's for diarrhea, so amount. So there are different types, and it is dependent on the brand that you buy.
Okay, I hope that answers our YouTube questions. Thank you so much. Thank you all so much. So let's quickly move on along. We're supposed to now be talking about budgeting in your homeschool. We're supposed to have an expert, somebody to talk, but I didn't find, or I didn't look at enough. but I'm going to be talking about budgeting in our homeschool, and I'm going to quickly talk about it. Basically just sharing my experience on how we budget in our homeschool, and please give me 1 second. I want to quickly. Okay. Doctor, you have to make me and the host again.
Okay, let me look for where I have to make you.
Just
participant.
The more beside my name, panelist. The more beside my name you see, I make me host.
I'm trying to find. Let me see. Participants. Let me find. Okay. Panelists. More. Okay. Make host. All right.
Yes. Okay.
Okay, done that now.
Thank you. Okay, so talking about budgeting for the homeschool, we know that when we talk about budgeting or money in general, it's usually relative to different people and to the particular situations that you're in, right? For some people, what you would term as expensive is not expensive to them. For some people, what you term as cheap, is what you would say is cheap to you is not cheap to some people. What am I saying? What you term as expensive, sorry, is not expensive to some people, right? And homeschooling is, for some people they will say homeschooling is expensive, and some people will say homeschooling is not, depending on whatever approach you decide to take, or depending on whatever what exactly you are spending on for you and your family. But one thing that I think should be common to both parties is planning, right? Whether you have a lot of money to splurge or you have whether you have a lot of money to splurge or you are trying to do it on a budget, right? What is important is that we plan, right? Generally, the things that make up right the expenses for a homeschool, just generally like across board, right? We say curriculum, which is a very huge expense, curriculum, field trips, educational supplies and resources, and extracurricular activities. So that's why I said that depending on whatever approach you take as a family, some people don't use curriculum, so they don't have that expense to deal with. Some people are not so big on doing field trips a lot of the time, and some people it's just field trips that they do. So depending on whatever route you're taking, which we're going to talk about tomorrow, how you categorize your expense or what you term as expensive, as being homeschooling being expensive, it depends on the route that you take. But generally across board, at least you are in one of all these categories. So I'm going to talk about how, depending on all these categories, right, what are the easy tips that we can use to budget, and also like, maybe you don't want to spend too much, or, you want to go all out. So these are some really quick tips that we can use to budget, right? So first of all, what I would say is that you need to be patient. And what I mean by being patient is be patient before you invest. There are some capital expenses sometimes that come with homeschooling. And for some, it is the curriculum, because when you choose a curriculum, not that it is too rigid that you can't change it, but it is a major expense, right? Because for people that use curriculum, they will tell you quickly that it gets expensive. Because as your child is growing, you probably have to buy new books, you probably have to buy new, you have to buy new this, buy new that. So I would say be patient before you invest, because it's an investment. So even if you are not in the curriculum route and you are, taking like maybe you want to travel, you are doing traveling, homeschooling, and all of that, I also say be patient before you invest. Or if you are also into, you have to buy materials like educational materials, I say be patient before you invest. Why? Because your child is a unique individual, and whatever your child is interested in, you don't want to rush and go and invest in something because it is you or you like this thing. Even for extracurricular activities, there are some things in our head that we want our children to do, and we are also very quick to like, oh, let them do this, let them do that. But then they are not doing. I did French for my son, French, and for the reason, I know the reason why they did not, adapt it, because it was online and all of that. But I already paid for the session, and they'll be doing classes, and my son will be at the door and be saying, teacher this one, teacher that one. I'm like, hey God, I've already paid, So assess your child, be patient before you invest in anything that you want to do. And it is even for curriculums. And I remember last year, Toki mentioned that before they invested in the curriculum that they currently use, they found somebody that used that curriculum, and they were able to see that, okay, will this work for us, will this not work for us, before they actually invested into buying the curriculum. So that's another way you investigate and all of that. Secondly, I would say that if you don't want to spend too much, start with DIY materials, right? Start with DIY materials. You can try to, for example, I just recently, like you people that follow me online, you know that I just recently did our playroom, which we did not have before. But most of these things are not exactly cheap like that. They're not exactly cheap like that. But we had done a lot of DIY. I had an idea of the things that I know that my son would play with. I didn't just buy everything because you know that there are a lot of things that we can buy and purchase and all of that. But I didn't just buy everything. I spent 2-3 years assessing and doing all the things that we were going to do with paper and everything. Even till now, my son will tell me, if I say he wants a robot, he say, Mommy, let's do it with paper. I was like, okay. Before we go and spend plenty money to buy a robot, he said, let's do it with paper. I was like, okay, that means, then that way I know that, okay, if I buy this robot, or if I buy this play kitchen, he's going to use it. He would have used carton to have done it first. Then I'm like, okay, fine, he will use it. So try DIYing. Try DIYing before you now, purchase. That's if you want to. And also, explore free field trips. People think that going out a lot is expensive. But the truth is that it's amazing how most of the educational places, like that, they cost little or nothing, especially when children are involved below 5 years old. They're either free for the children or 200 naira or 500. A lot of all the places that we've gone to is 200 naira, 500 naira for the children. If it's out of Lagos, it's 500 naira. I'm telling you, when we went to Ibadan and Abeokuta, almost everything 500 naira. I was like, okay, what are we doing in Lagos? Before you blink, 3,000. Before you blink, 6,000 for one, play place. And I'm like, these places are, so they're not. Some of these places are not as expensive as we think they are. The places that now get expensive are the ones that now have rides and all of that. And for me, as a homeschooling mom, that's not my own priority. We can do that one for holiday, and I won't mind splurging on all those ones. But for the educational ones that will go to a zoo and all of that, most of these things are free for children younger than 5 most of the time, or they pay 1,000 naira, 700 naira, 500 naira. So also look for free or minimum, field trips, and not think that, taking your child out has to do with all those ones that are amusement package, kind of. Yeah. Then another way that I also try to cut down on our expenses is I buy our materials in bulk. All the resources that we use, cardboard, all of those things that essentially that we are supposed to have at home, I buy them in bulk and I buy them in Eco. But now, of course, I can't go now, but I try to not go to maybe all these whole big supermarkets, and you'll be amazed how not so expensive these things are when you go to Eco. So, yeah, buy things in bulk. And okay, also because, I've not bought anything this year, like any cardboard or anything. We're already in September. Because I bought them last year. So I try to plan in advance, and then I go to the market and I buy all of these things. And because, some of these things, you can also reuse them, it also helps, right? And it cuts down on expenses. And the other thing that I probably need to buy here and there is maybe I need to refill vinegar or something, Please, if you have where they sell big jars of vinegar, please tell me. Anywho, then also try to get group discounts for field trips. I don't know how, but if you, come up with coming together, not just you going for field trips, you can approach these people and ask for a discount for, we're going to be 5, we're going to be 6. Is there a possibility for you to give us discount for coming to your facility and all of that? It's always worth the try. And you'll be amazed at people that are willing to give discounts for you to come to their facility, and talk about them after, right? Like, we'll give you discount, but please talk about us after, so like a win-win situation, and say, okay, when we leave here, we'll talk about our experience and we'll ensure that we tell people about this place so that more people can come. They'll be willing to, give discounts. Then, okay, like I mentioned, curriculums used by others. test it out, find somebody that maybe uses the curriculum that you want to use and test it out. Or some of these curriculums actually give you ability to test them out online before you actually invest in them. So that's another option. Then one other way that I try to manage our expenses is that I become a all-in-one mom, especially because my child is still very young. I literally learn everything. I learned everything. And when I saw that my son was not interested in French, as far as online French, because that was what was available to us at the time, I went to go and learn French. Not learn, but I said, oh yeah, we're going to be learning together, right? So I became all in one. So as little as the basics, I'm not going to learn everything to go and teach him, oh, this is the structure of how French is. I'm not going to do that. I don't have the knowledge of all of that. But basic French, basic piano of, oh, this is where the tonic is, this is what the song is, this is what that. I use Google to learn all those things, and I teach my son. Till he's older, at least that one I also used to know what his interests are. As basic as what's it called? Karate. We learn the basics. I mean, this is what they will say, how they say it, this is how they punch, this is how they do. So at least when you see that your child is interested in that, more interested in this one, you now know, okay, you learn how to, things like maybe swimming. I don't know how to swim, and I can't learn that one on Google. But as much as I can learn on Google, Google is your friend. Find, if you have the capacity to try and learn the basic stuff. So as the child grows older, then you can now say, okay, this one is what is most interested in. As in with my full chest, really tell me to bring, 200K to go and learn one. Now with my full chest, I'll be able to say, okay, go and learn this because you have shown enough interest in it, right? And so my son more into, I've seen that he likes the piano and all of that. So I know that, okay, when the time has come, I'm going to, get him a teacher to help him with the other rest of the journey. You get, right? And also, don't stress, like there are some things that you'll probably not be able to have. There are some things that you'll probably not be able to get. There are some things that you don't stress about, the things that you can get at a particular time, right? And it's really important, of course, it's also a lesson in contentment for our children and us as well. Whatever we can afford at a particular time, we should be fine with it and plan towards where we can actually afford it. The truth is that I really wish, right, that I could just get up and get off to wherever I want to with my child and go, but it's not a possibility right now. So I'm okay with it, that I cannot. Where I can go to, I will go. You get, so wherever we are in our journey, what we can't afford per time, we should be fine with it, right? Even there are some, and even materials that we might be able to afford them, but we don't want to, it's fine. Let's be fine with it. Then planning for our children's future in education. Now, some people, depending on what we want for our children, based off of their educational journey, some of them will not be homeschooled forever. Some people, they'll be willing to go the long haul. Wherever journey you are in, it's important that you plan. And it's not just children that are going to school, quote and unquote, right? Or traditional school, that people will say, oh, come and do insurance for your children, come and do insurance for your children. I think we should also, as homeschoolers, be willing to plan for the future of our children educationally, whatever that education means to us. If it is, for me, it is maybe putting it saving so that we can be able to travel, and I can be able to get off whenever I want. For you, it might be that, oh, my child is going to go into secondary school after the homeschool for the primary level. So we are planning towards that. Or it is to make sure that when this child is 4 years old, 3 years old, I don't want to bother my head about extracurricular activity payments and whatnot. You know, as the way people are budgeting and planning for school fees, you too, as a homeschooler, we can also plan for our children. To be honest, I asked a lot of all these insurance companies while I was trying to look for somebody to come and speak to us for this session. I asked, and a lot of them, they're only available for people that are like, oh, okay, 5 years down the line, that's when you can this. And I think that it's a lesson, maybe, in trying to, and I find somebody to work with homeschoolers, that it's not just maybe 5 years before my child will go to secondary school. We need to plan also for next year. We need to plan they should have a plan to be able to say that I can take my money out after 1 year, so I can plan for our next homeschool year, the places we are going to, where we are traveling to. You get? And truthfully, a lot of all these insurance companies and all, they have plans as low as, paying 10,000 naira monthly, paying 5,000 naira monthly, paying something monthly, so that you can be able to now plan properly for the future. But I think it's very, very important for us to, as homeschoolers, to plan and think about their future wherever they are, we think that whatever point we think that, this is what we want to use the money for, plan towards that. And not up until this year, I never really planned financially, quote and unquote. I never planned financially. I always just planned that, oh, this is where we're going to go, this is what we're going to do for the year. But I never thought about, oh, okay, putting money aside so that next year will be easier. Because there are some times that, let's be honest with ourselves, we might not really have the money to make it a consistent thing to go out and pay for these things. Because the truth is that they can really, really, truly start getting expensive, right? So when you say, oh, we are going to this place here, today it's 5K, next tomorrow, we have to go, and you go out maybe twice in a week. This other place is 5K, you get, but there are still some places that you have to still go to these places. While there are places that you go 500 and all of that, while you keep consistently going, the money keeps climbing, right? You think, okay, yes, it's cheap, but as you consistently have to start going, the money keeps climbing. So I have to start thinking, properly the beginning of this year and say that, I need to start planning for how this thing will be easier, because you have to start thinking, okay, it's not as if you don't put money aside at the beginning of a month or something, but it gets expensive, right? And today I was like, no, I want to go and play. I want to play. The one that you plan for, right? So planning so that it will be easier for next year, so that it will be easier. So however little it is that we can keep putting aside, even if you want to invest and do it with all these insurance companies, they have such great plans that, they will give you money back next year and all of that. But of course, do your due diligence and everything. So, yeah. Then, so I hope that this point, help us to be, to plan properly and to see how we can, cut down on some of the expenses that come with homeschooling. And yeah, so if you have any comments, questions. Okay. Can you provide a list of resources for under 5, a list of places to go for recreation and field trips? I have that already, so I'm going to share everything again. Even with the great prices of things that skyrocketing, budgeting is important. Very true. Yep. Yeah. So I have a list of resources for under 5 years old. I have a list of must-haves you should have at home. I have a list of places that you can go that are literally, some of them are under 2,000 naira, some of them are for free in Lagos, some in Abuja and Ibadan and Abeokuta. Then we also have Adeshola. She goes to our resource testing in Abuja, so she has a lot of places on her page, raising.id. Let me type that in comment section. If you want to, for Abuja, I have for Lagos, but yeah. So for Abuja, if you want a list of places to go on our Instagram, she shares all of that. So any questions? Okay, what do you mean by curriculum? Okay, what do I mean by curriculum? So basically, curriculum is set of instructions. Like, okay, how do I put this now? What people use to teach children in traditional schools, but not just traditional schools, of course, but what people use, set of instructions that people use to teach children. Please, I need curriculum. Okay. We'll talk about all of that tomorrow and go in depth into curriculums and all of that. We'll talk about that tomorrow, but I can't just give a curriculum because there are different curriculums based off of who the person, so depending on what approach you want to do or the way you want to go, there are different curriculums that you can adopt, and there are plenty. So any questions before we go to our next line item? So very quickly, do you have any more questions? Okay, one more question. Can I partially homeschool? I'm a working mom of 3 with no nanny. Absolutely. I would say absolutely. You can. Yes, you can. Absolutely. Because let's be honest, it's not easy. You don't have a nanny, you are working, you can actually homeschool. Partially or fully set if you want. So we have people that fully homeschool their children and they're working, right? They have tutors that come to their home. They have tutors that come to their home to help them with the process, and they are involved in the process of what goes on in the homeschool, right? So they do it while they are working, right? And their children are being homeschooled. Yeah. And there are some people, when they get home in the evening, they focus on the kids, they do what they want to do, and that's it. So it all depends on you at the end of the day. But yes, it's possible. Okay, so any more recommendations on tutor? I know somebody's calling me, but we're not answering. So recommendations on tutor. I don't know. I can't recommend, but I know a few people that, so I'll compile a list of the places we can get tutors. I've not used them, so I cannot vouch, but I know a couple of people, right? So, but I will do it. I will do a list, definitely. I'll definitely do a list. So if there are not any more questions, I'll quickly go to the next line of item. I want to invite, okay. I want to invite for her, one of our partners for the event that helps us, in making sure that this happens. Let me find her here. So she's going to quickly come to talk to us. Let me find her here. Sorry. Wow. Please, are you here? Okay. I saw her earlier. You just raise your hand so that I can't find. I can't find her. Please just raise your hand if you're here. Things are alphabetically now. Okay. She was here earlier, but okay, whenever she comes in, she's supposed to talk to us quickly about her products and her services. But yeah, when she gets in here, I will let me quickly message her. So, but she'll talk to us before we're done. So finally, let's bring in our last speaker, who's going to talk to us basically about, he's a dad, he's a homeschooling dad, and he's going to be talking to us about his perspective as a homeschooling dad and how homeschooling dads can also help. I know that there might be mostly women here for a huge percentage, I'm sure. There are mostly women here, but at least it can be talking points for us with our spouses if this is something that we are looking to do. And it's going to be recorded. It's being recorded, so we can also, shoot them the video once it's done, so that they can. Okay, so move to panelists and make a co-host. All right. Okay, so the replay is going to be available for him to watch and listen. So let's make him a co-host. Right, but before we go on, let me quickly read to us his profile. Oh, sorry. Okay, sorry, I can't find it, but please, Mr. Somi, the floor is yours. I'm okay. So sorry.
And good evening, Kodo. How are you doing?
I'm fine, thank you.
And you can see me and hear me clearly?
Yes, I can.
Okay, brilliant. So I'll introduce myself. My name is Somi Lajuomi, and I am a husband and a father to 2 children, a boy and a girl. My son is going to be 4 in January, and my daughter is going to be 2 in February. Yeah, I was really praying and hoping that she'll be born on the same day as my son, because they are just 2 weeks apart, but I guess that wasn't meant to happen. So my wife told me about you and this event, and I was really excited to speak here, because I feel like there is an overwhelming majority of women that support this, and it looks like the men don't. So I think we need to encourage more men to say their opinion. So I'm really, really grateful that you are doing this. It's something that is really needed in this community, yeah? So like you said, I'll be talking today about my experience, really, of doing nothing whilst my wife does everything. Yeah. So she's a great woman. She's literally the one that is, really nurturing our children, right? And I'm hoping that whatever I say here today, someone will be able to take 1 or 2 things from it. But one thing I want to share with everybody is whatever I'm saying, please don't use it as a judgment point for yourself. Yeah. Do not compare. Nobody knows it all. We're all sharing experiences, right? So I have 4 slides, just 4-page slides that I want to share, but I don't think I can share my screen. How do I show it?
I think you should be able to.
Okay, it says it's disabled. Disabled participants screen sharing.
Okay, so let me just make you. Okay, let me just make you a host so that you'll be able to do that.
Mm-hmm.
Okay. So I've done that now. You should be able to share.
Sure, yeah. So I can share now. Okay, can you see my screen?
Yes.
Okay, so this is a short presentation. Just use it as a talking point, right? So I might be going off point, but overall, you'll get the gist hopefully, yeah? So in essence, before I show you the main slide, I would like to show you, talk to you or talk you through our paradigm, how we see schooling, because that's literally the foundation of how we are going about raising our children, yeah? So the first thing on the paradigm is that we believe that children learn better through experience rather than through being taught or through being led towards a particular direction. Again, I like to, when I think about children, I look at children as essentially an example of what we are supposed to be in nature, our most natural self, yeah? So before we got to this point of sophisticated civilization, we were literally in nature and we had to learn everything and become one with everything. So allowing children to learn through experience then enables them to be curious and to secondly choose their own path, which leads me to the second point on our schooling paradigm. All humans have natural inclinations. That's our belief here when it comes to schooling. All humans have natural inclinations, and that is why we have varying interests. So I, for example, I studied computing, but my core interest I got to find out is business, politics, economics, philosophy, and psychology and music, yeah? If you talk to me about football, I'm not a big fan of football. I'm not a big fan of sports, apart from golf that I play for relaxation. Whereas my son loves anything to do with trucks, right? And my daughter loves anything to do with destroying things and opening them up. So we believe that it's essentially about us following a natural inclination. In essence, we believe in purpose, yeah? So, and that's why, and then the next one is the final one is we practice unschooling, which is a form of homeschooling, which is essentially following the child's interests rather than trying to take them through a curriculum, yeah? So the way that works is that my wife and a group of friends, they go out once a while to places like parks. You can see them in the park digging sand, yeah? Also, they go to zoos, and in these places, they're actually exposed to a lot of knowledge. For example, if my son is reading about lions in books, he's able to see lions in the zoo and then make a relation, a link here, that what he's reading about is what he's seeing. In the picture you see there with my son and my daughter, with them digging the sand, you can only imagine how many things they are learning. They are experiencing the texture of different sands as they are digging. They probably will see one or two insects, right? Etc. So these are stuff that go beyond 1, 2, 3, ABC. That's fine, but again, our own core belief is that, our paradigm is that by exposing them to nature, by exposing them to different things where they can then experience themselves, they will be able to find their natural inclination, and then will be able to grow up to be well-adjusted adults, yeah? Wholesome children. So with that said, I'll now take you through the little part I play in supporting my son. So this reads from right to left, yeah? Now, the first thing that I do is that I trust my son. What that means is that I am essentially the person responsible. My job in the family unit, yeah, is primarily bringing in the finance and also the mindsets, yeah? But my son is primarily responsible for nurturing. There's also a model that is well known in human beings, which is the model of the provider and the nurturer. So that's the sort of structure of our family unit, right? So my wife now, who is the stay-at-home mom, which although she doesn't stay at home, so I don't know why we call her a stay-at-home mom. She's always outside with the children and exploring. But for the purpose of this event, I'll use the word Sam. So my wife, who is the Sam now, spends the most time with my children, isn't it? Whilst I'm out there working, she's spending time with them. So she knows them more, which means I just have to shut my shall I say, preconceived notions and then just trust her judgment in terms of the inclination of our children. Yeah, so that's the first thing I do. I trust her judgment. Now, of course, if you trust someone's judgment, how do you know that they are not going to mess up? I do that by leading by example. That's the second thing I do around. That's point 1B around how I support my son. I lead by example. You wouldn't find me doing what most men do. Not that I'm a saint. Everyone has something that they do that they shouldn't be doing, but at least I try my best, yeah, in my human flesh to be a wonderful man. Because guess what? My son sees me and says, if my son is doing something he's not supposed to be doing, all I need to say is, do I do that to your mom? And he says, no, you don't. And then he gets the message, yeah? So I lead by example. And my wife too, actually, even though she doesn't, I'm the talker, but even though she doesn't say much, but I know she respects my leadership because she shows it in her action, in the kind of lovely food she makes for me and how she's a wonderful wife, yeah? So that's it. By leading by example and trusting her, that's the first thing. The second thing that we do, that I actually do primarily, is enabling a positive environment, yeah? Remember on my first slide, I said one of our paradigm is children learn better through experience. And again, learning through experience, I said, is consistent with how we are naturally. That's how we're able to co-create with nature and invent things that we're enjoying today. Because none of this was existing before. There was no pre-existing knowledge before the first man existed. Everything was made in collaboration with nature through us. So enabling a positive environment. Now, I love Jay-Z, for example, right? I still listen to Jay-Z today. But when my son is coming, I just shut off the music. I'm like, I wasn't playing anything, no. So that kind of stuff, I don't expose them to. In terms of what he watches, and my daughter too, in terms of what they watch, we literally ensure that, my wife literally ensures that she's checking them out. So the way I then go about it is I ensure that I don't expose my children to something negative, whereby I'm now giving my wife more work, yeah? So consciously choosing our environment, choosing the kind of friends I hang out with, very, very consciously, right? And they say, show me your friend and I'll tell you who you are. I believe in that strongly. So if I don't bring any person that is not somebody of integrity, somebody of value around my wife, then that allows her to still maintain that positive environment in which she can nurture my children, yeah? Then the third one is ensuring healthy nutrition. So because of my wife, I cut out Coke, Fanta, etc. Goes back to leading by example, right? Because children are watching. So by ensuring that I follow her type of nutrition, I am able to then make it easier for her to show my children that this is what they should be eating and this is what they shouldn't be eating. Then the next one is maintaining a positive mindset, yeah? So now, this I consciously do. As I mentioned, my wife is always around my children. She's the one that's nurturing them, right? So if she's around my children and children learn through experience, then they are picking every little cue, every little what she's saying, every body movement, everything she's doing, they are watching. So I then ensure that I don't put my wife in a negative mind state, right? Whereby the children are now rubbing off on it. For example, I make sure that I tell her that she's beautiful all the time, yeah, which I actually believe. She's 100% stunning. I think she's the most beautiful woman in the world. Then I also ensure that I encourage her. Whenever she comes back from their outing, I ask how it went. She even corrected me because before I used to say, so what are they learning now, right? And then she will say, that's not what to ask. You can say, what stage are they at? But it's not about learning. We're just going at their own pace. And lo and behold, my son that is almost 4 now, he uses some miraculous words that I don't know where he's getting them from. He knows so much. So just trusting what she says and again, suppressing my own opinion and ensuring that she is in a positive mindset, yeah? Speaking about positive things together, encouraging her when there are hard times, ensuring that I am basically still telling her things will be better. Although she does that for me more than, she's usually more stoic than I am. So positive mindset, yeah? Then the next one, this one is a very, very big one. So for the men in the house, right? I would like you to repeat after me. It is not my money, it is our money, yeah? That should be your mantra. Say that every morning. Now, why is that? Remember I mentioned that a family is a unit and our model is the provider-nurturer unit, yeah? So just imagine back then in the jungle, when we were still in the jungle running away from predators, yeah? And chasing prey. You have two types of people. You have the hunters and the gatherers. Humans are not new to roles and responsibilities in units, right? So now, God has given me the talent to make money. I know how to create wealth by God's grace, right? So in this unit, I am better off going out to create wealth, yeah? But if you leave me with my son actually, I don't know, maybe he just does it intentionally, because every time I come back, he just starts jumping on me, because he knows I can't take it for long, right? But my wife can take it more than I can. She has the patience for children. But guess what? If you look at us from the outside, all you see is bliss and love and unity. Does that make sense? Now, how do we do that? I remember a few years ago, I was gisting with my friends. Then when I was dating my wife, I was already showing her my bank statements, letting her know where all my money is coming from, etc. Yeah. And I was telling my friends, and they laughed at me and they said, wow, your girlfriend is your accountant. So I don't know where this mindset comes from, that women should not know what men are earning, right? I really don't know. If you don't have anything to hide, then why are you hiding your money? So now, I then started building that mindset, started thinking, you know what? If I want to have a healthy relationship with my wife, I need to make sure that I don't see this money as my money, right? I see it as our money. So from then on, as we're making more and more income, very recently, when I take, even though I own my company, I put myself on a salary, right? So Kodu, when you're doing an event on financial discipline, I should be invited to. So I put myself on the salary. And when my salary comes in every month, at the end of the month, I take my own share, which is actually not much. And my share is for my golf, to fuel my car, and to buy airtime. Yeah, I hardly buy much clothes. We are minimalists. So anything I need, I take that. My wife also gets a salary, because I honestly think being a Sam is a very, very hard work, right? So she gets a salary from this money that comes in. And my children too get a share for what they need for the month, right? For their outing, for anything that they need for their well-being. Now, not once have I asked my wife, what is she doing with money, right? She's probably, I don't even see her account. The account I transfer it to, I don't see it, yeah? Then we take the larger chunk of it. We take 10% as well, put it in savings. And the larger chunk of it, so if we minus about 60% of it, goes into a bank account that is in my wife's name. And she just uses that to run the house, right? So I've never seen her statement, yeah? Likewise, she doesn't see my own statement. That's where the trust comes in. Remember, trust your son. But I know when I wake up in the morning, my yogurt is there with my granola and my grapes. I'm having breakfast. When I get home at night, my food is there. When she wants to go out, she goes out. If her car is faulty, I've even told her to stop disturbing me. I showed her where the mechanic is. She drives there herself. So now I've called it, if you notice, I said there, embrace financial equality, which will lead me to the second point on this finance, yeah? We don't practice financial security or financial stability. We practice financial equality, because the reason is that I got her to get to a point where she's not anxious about money, right? So not because there's so much of it, but because we started to see money as a tool. I started to realize that it's the person behind the money that determines the value of the money, right? So I'm valuable. Wherever I am, I can make money. That's my core belief here. So we practice financial equality, whereby whatever comes in is for the family. Now, what does that help us with? You have to realize, Kodo, that the number one anxiety that people have in the world is poverty, the fear of poverty, yeah? It drives us crazy. But it's weird to me, in a world where there is abundance, right? Why we're afraid of hunger and poverty, yeah? So by not seeing money as a do or die affair, knowing that we can always create wealth, this is what happens. Our children will not grow up determining their self-worth with material items, thinking if I don't have this, then I'm not good enough, right? So I support my wife by ensuring that she doesn't have to worry about money, so that my children will not associate money having with self-worth, right? My wife even says it, and I know she's not joking, because she says, if we lose it all today, don't worry, we're just gonna find one room to share, and I'm sure we'll start again and be fine. Yeah. Then finally, this is the most important one of all. If you forget everything I have said, remember this: you have to trust the process, right? My belief, I won't enforce it on anyone, but my belief is that there is an all-knowing creator that is bigger than you and I, that is bigger than any religion you can think of, any race you can think of, anybody you can think of, right? That has sent you here for a reason. So I now believe that I am here with my wife to support her, really, to support her to bring up 2 or more wonderful children, who knows? But for now, 2 wonderful children, yeah, that will end up making a wonderful impact and leaving the world better than me and my wife could even imagine. So that's actually my core purpose. So my number 1 value is on the wall here, so I always read it every morning. My family's well-being is most important to me, right? So I'm trusting the process. And then a lovely quote that I like is from Rumi, who said, I have been knocking all my life asking to be let in. Now that I am older, I realize that I have been knocking from inside all along. Yeah. So myself, I just support my wife, trusting that whatever she's doing, everything will be all right. And by so doing, I let go and I let God. So very quickly in summary, the first thing that I do is I trust my son. The second thing is I enable a positive environment. The third thing is I support her in her nutritional plan. The fourth thing is I maintain a positive mindset, and that rubs off on her too. The fifth one is we embrace financial equality. And finally, I trust the process, and we trust that everything will turn out well. So that's it. So I think it's time for us to talk. Let's talk. If anyone has any question, I'm happy to take your questions.
Please, I've been in here for too long and the crew is shouting for me. But thank you so much. This was really good. really good. Thank you so much. Thank you so much for your key points. I think that, every man that, wants to go into the homeschooling thing, and even for me, like some of the things you mentioned that have challenged me also to think about how I can be better, right? And I think that everyone should. So if you have any questions, please leave them in the question tab, question box. If you have any questions or comments, leave them there. So I would. Yeah, so question, was it a modeled lifestyle and approach to life for you as a kid? I mean, so as a child, was this a modeled lifestyle for you?
Okay, so that's a very powerful question. And I was thinking, I won't make it about me, yeah? But I'll touch on it. I'll answer that as best as I can. So the thing is, I grew up with a completely different model, right? So in a nutshell, I grew up with traditional African parents, Nigerian parents. But the truth is they try their best. I'm not knocking them. They try their best, right? So growing up, I went through the usual. If I wasn't doing fine, I get a name calling. If I did extremely bad, I got the odd beating, right? So I grew up in a traditional Nigerian household, which I believe 99% of us had that same experience. So it wasn't a model for me at all. But one thing my parents did give me is that they've always pushed us to always do our best, and they gave us solid values, right? Solid values.
Sorry. Okay, so another question is, how do you deal with extended family and generally people's opinion about your homeschooling model?
Okay, so the first thing is I've gone through interesting phases with my family, yeah. But there was a time of clash, my extended family, where everything we were doing seemed like we were very odd people, right? But remember, I said you just have to trust the process, yeah? So sometimes they say stuff that I listen to and I'm able to adapt it. Nobody knows it all, right? But at the same time, too, you also have to trust what you're doing and do not depend on anybody for your self-assurance, right? And the thing is, if it turns out fine, take it, yeah, that I did fine. If it turns out bad, own it, right? These are your children, remember. And guess what? One thing I've realized, Cuddle, is that, people don't take advice, yeah? So I've realized that every advice I've given, most people just do what they want at the end of the day. So just do you, and eventually they will come round to it and realize that, man, at the end of the day, these children are growing up wonderful, right? So for example, the main, if I can touch on this, the biggest criticism, by the way, we were even doing beyond homeschooling. They'll be like, they also need unschooling. You understand where I'm coming from? So the biggest criticism of homeschooling is this social stuff, right? But you realize that actually, have you watched The Matrix, the movie The Matrix? Okay, if you haven't watched The Matrix, it's about this guy, Neo, that was living in a computer world with everybody else, and then he was taken out, and he could now see how everybody was thinking. So there's a level of thinking where your mind gets to, that your paradigm shifts completely, and you start to look at things in a different way. You question what everybody else is doing. Not that you are better than them, you just think different. So for example, the whole idea of homeschooling killing the social part, right? I don't know where that comes from. Now, children are able to hang out with other children. Like my kids now, we create an environment for them where they can hang out with other children, right? And I'm not criticizing anybody. If your child goes to school, maybe your setup is different, fine, yeah? But I just have to answer the question in all honesty, and the truth shall set me free. Now, what's social about locking a child up in a room for hours and then they get just 1 hour of break, right? How's that social? Does that make sense? And then the whole thing of their peer group, literally, if you look around your circle, how many people are your age group? You usually hang out with people that are either older or younger, right? So the idea is just do you, please, right? Don't bother about what anybody is saying, please.
Yeah, great point. And people are making some points in the session. We have a session for homeschooling models, yes.
But sorry, can I point out one more thing too, yeah? Sorry, on the social skills, I actually think school killed my confidence. I went to King's College, right, where I was beaten badly. My primary school, terrible. So I actually had the opposite experience, whereby school, actually, I was bullied a lot. I had to spend majority of my adulthood finding myself. Does that make sense? Whereby I could have been given an environment where I was self-aware from young. Again, my parents did great. I think they did a wonderful job for what they knew, right? Coming from the village. But honestly, social, I don't buy that nonsense of social.
Okay. Yeah, I have a question for you though. So as a father, and how do you maintain the bond with your children? Seeing that you are either away or busy and things like that, and your wife is, mostly, because that's my own experience as well. Like I hang out more with my kids than my husband does. So, but how do you maintain the bond with your children?
Okay. First, I'll answer it by saying I don't believe you can achieve work-life balance. It's a fallacy, yeah? Something has to give, right? You can't achieve work-life balance. It doesn't work. But you can try to achieve 80-20, 80% at work, 20% with your children. So the 20% is when I come home in the evening, right? I do my very best to turn everything off, yeah? I turn my phone off. I just focus on my children, focus on my family, right? So they have where they pick their books and they can bring books for us to read. Or sometimes I'm just playing with my son. And like I said, their favorite, he thinks he's strong. So he likes wrestling me, my son. But from there, he's also learning mindset. He actually believes he thinks he can beat me. I don't know where he's getting that from. So that's from that 20% I'm spending with him. And also on weekends, Saturdays, we go out to restaurants like crazy. I love cilantro. So my favorite time is eating cilantro fried rice with my children and my wife, right? So those times I make for them. But one thing I must also commend my wife though is that actually sometimes if I'm just chilling, she'll be like, you better go and work. You don't have anything to do. So she understands fully that I cannot be 50-50 and a work-life balance is a fallacy. Does that answer your question?
Yes, it does. Yes, it does. So somebody made a comment here, and yeah, the social skill is the angle that comes from. They come from, but my daughter became even more social when we started homeschooling. That alone brought my husband over. She's very confident and vocal now. You know. Easy. Okay. Children in school, after school, can be either bold or timid. Yeah. Okay. Please don't say your wife sounds like a saint.
She is. Even if anybody else thinks she's a devil, that's their business. She's a saint to me.
Okay, so please, can you reshare the percentage you use in budgeting your finances?
Okay. So what we do is we basically go by. What we do is we take 10%, yeah, and we put it in savings. We take 30 to 40% and we distribute it as our national cake. And then the remaining 60%, the remaining 40%, yeah, we put it in an account where my wife runs, and it's literally to run the house, right? So when we are buying food in the house, or maybe we are fixing anything, or maybe we are going out to eat, everything comes from that account, yeah? So my wife has another account where I transfer her own share and my children's share, and everything that she does, like her hair, and maybe she's buying anything for herself, maybe she's taking the children out, comes from that account. And then there's an account where we save 10%. Maybe the only reason we touch it is if there's any additional expense that we didn't plan for, maybe to support family or anything like that, it comes from that account. So in a nutshell, the formula is 10% to savings, yeah? Then 40% we share among ourselves, and the remaining 50% we put in an account we call operations account for running the house. But the most important thing is I don't know why I don't run the other two accounts. I only run my own little tiny account. But it's also because my wife is a better money manager. Do you know my car that I'm driving? Let me just give you an example. I can buy plenty more of it, but my wife is the reason why I haven't changed it. She tells me, what do you want? Who do you want to show off for? You've already caught me. There's nobody to impress. That's how we.
Okay. So are there any more questions? It's very, very enlightening. Let's check YouTube this time around before they accuse me. Okay, so do you have any questions on YouTube? Okay, no, we don't. Okay, so thank you so much.
Thank you.
Okay, somebody would like to know what the long-term plan is. I don't know if you're
for me or for the family.
Yeah.
Is it for my own or for the family?
Yeah, that's what I'm like for the family.
Or for the children. Okay. So the long-term plan, yeah? The long-term plan from the children's perspective is I'm just trusting again what my wife is saying, what my wife is planning for us, which I actually trust will work. So the idea is that as our children are growing up and we are seeing their natural inclination, we may put them with apprentices, like with teachers, right? To mentor them. So my son now is showing something to do with engineering. When he gets to a particular age, we are going to write to Tesla, yeah? And all these kind of companies and try to get them to take him on as an apprentice, right? Because that's the best way he can learn. May I also add that this is our form of schooling. I'm not bashing anything. trust me, I just have to see. I've been asked a question, so I'll answer it from my own view. So this form of schooling is recent. Universities are new. Where Western education really started from was 3,000 years ago from the Greeks and the Romans, right? And the Greeks then, Plato and Socrates' time. What they used to do was, as you are growing up, they will put you as a child in a particular circle that fits you. So if you're a child that likes to fight or something, they'll say you're going to be a soldier. They'll put you with the best soldiers. If you are someone that you have existential intelligence, they will put you with philosophers, etc. That's how schooling was. So that's the form of model. That's the type of model we are following, right? My daughter, I think she's going to be a politician. So I'm looking for the best politician to put her with.
Yeah, yes. Oh, that's absolutely.
Then can I just also add on this? You know, people worry again that, oh, how are they going to get jobs in future, certificates? You can actually still take exams, right? If you're homeschooling, yeah? And trust me, my children are going to be very bright only because they are doing what they love to do. And if you're doing what you love to do, right? You will be able to even smash it easily. So I have no problems about that in terms of how well they do. You get?
Yeah. Okay, so a few people raising their hands. So I don't know. Okay, let me see if I can. Okay, so you have the right, I think, you have the host right. You can.
Okay. So what do I do now? Guide me.
Just, the people raising their hands, so maybe they want to ask their questions verbally.
Okay, I can switch back host right to you. How do I do that?
On my name, under panelist.
Okay, more, make host. I found it.
Okay. So, Ajayi, but please let me quickly check. Okay, so but before we ask those questions, right? I want to quickly bring on Oge of That Igbo Child. She wants to quickly talk to us about what she does. So please 1 second. We'll get to the questions, but let's get to That Igbo Child. So hi, Oge. Okay. Let me ask her to unmute. This validation. Okay. Okay. So since I don't know. I thought she was ready to talk. Okay. So let me give Ajayi Afolake. Are you ready?
Yes.
Ajayi Afolake, I've given you the right to talk, so please unmute that question or comment. I don't know. Hello. Okay, so please, if you're ready to talk, let me know. Catherine Williams. Let me see. Are you ready? Ready to talk? Okay, not yet. Let's ask Adibola, but I don't know who was. Adibola, are you ready?
Hello, I can hear you, Adibola.
Yes. All right.
All right. Thank you so much, sir, for such an insightful session. I'm happy that Kodu brought this topic because the role father play in nurturing and mentoring these children is so critical. You know, I have girls, and in fact, they bond. They want to be around their dad more than myself. You know, a lot of girls like to be with their dad. But my question is, how do I get my husband to be intentional about parenting? For him, he wants to look for money. When I tell him, no, let's pay attention to these children, let's teach them, hey, I'm looking for money. He's barely at home. Like you said, you are intentional about it. You come back. I'm not comparing, but I'm just asking. I've tried my best. He's young. He's like you. So I expect that he's aware. He should know, and like you said, I've learned so much from this session today. And especially that you mentioned about your wife, all the things you mentioned, I had to pick them. That she must really be such a great wife and mother, and I really hope to improve on what I'm already doing. So how do I really bring him on board to teach? If for instance, as little as allowing a 3-year-old wear their shoe, he won't. He will say, why can't I wear it for them? Say, let them learn to be independent. So how do I, because it's been an issue, even this homeschooling thing, he does not believe in it. Homeschooling, what am I teaching them? What do I know that I want to go and put them in school? So how do I really get him involved to, or I should just let him be looking for money and I should continue my own? Because one way or the other, his own is also indirectly or directly having impact on them. Thank you.
Okay. So I'll speak generally rather than specifically, right? Because everybody's setup is different, yeah? But what I can tell you is that if you focus on yourself, right? And he sees that you're doing great things with the children, I believe you eventually come around to your way, yeah? So, for example, try not to criticize him for a long period of time, yeah? Rather, when he is around, put on YouTube, put on videos about homeschooling. Let him be hearing. It will be entering the subconscious, yeah? When you're having conversations, even if you don't think he's paying attention, just tell him what you have learned on homeschooling and how you are applying it, right? Eventually, he will come around. Remember, Gandhi said, be the change you want to see, yeah? So if he's chasing the money, yeah, don't worry, don't make him feel like he's doing a wrong thing, because men don't like to talk. Although I like to talk a lot, but generally men don't like to talk, right? So he might actually be chasing the money for the family. I might not be honest, might be thinking you are sabotaging him in the deep subconscious. I'm just making this up now as an example of why you should try to just not broach the topic for some time, and you see that he will eventually come around. So to summarize, generally speaking, rather than focusing on him and what he's not doing, just focus on all your energy on what you can do, right? And then he will start to pick it subconsciously and it will eventually come around. But also, Adebola, you also have to ask yourself, yeah, if it doesn't come around, are you comfortable with that, right? Are you willing to sacrifice anything to ensure that your children have the best form of environment that you believe in, yeah? Because bear in mind, it's about your children. How radical can you be about this? If you can make up your mind that, you know what, whether anybody supports me or not, I'll do this on my own. I promise you, you have more supporters than you can imagine. And I'm sure your husband will be number one.
Thank you very much.
My pleasure.
Okay. I'm going to bring on. We have one question. We still have some questions, but I do want to bring on OJ to talk about services and our products that can be beneficial to us. Okay, so OJ, the floor is yours.
Okay, can you hear me now, please?
Yes, we can.
Can you hear me now, please?
Yes, we can. Yes, we can.
Okay, awesome. Okay, I'm still trying to figure out this video thing. Good evening, ladies and gentlemen. It's just been an amazing session. Please bear with me while I try to figure out this where to switch on the video. Okay, while I'm still trying to do that, I'll just carry on so I don't waste anyone's time. so my name is Oge Okonkwo. I am the lady behind the brand, That's Igbo Child. And basically, That Igbo Child is just a brand that helps to equip parents to raise or be intentional about teaching their kids the Igbo language, the Igbo culture, through fun learning resources. So am I still on? I hope I'm still on this technology. Tommy, can you hear me, please?
Yes, I can hear you.
Okay, awesome. I don't know, because on my end, you actually everyone's frozen. So that's what I'm wondering. I was hoping that I could put on my camera so I could be able to show people, show the audience our resources. So we range the resources, the target, the kids that I usually focus on, it's from 0 to 10, because from my research, I have learned that that's an amazing age where kids have this amazing ability to be able to grasp not 1, not 2, at least 5 languages at most. They can do it much, much better than adults. And so we have flashcards. And the brilliant thing about our resources is, for example, the storybooks that are bilingual, because we understand that maybe some parents, kids are sometimes also raised in mixed marriages. So you also have marriages that you have an Igbo parent or an Igbo speaking parent, and then you have like a Yoruba speaking parent. So we understand that, okay, that's why we go towards selling bilingual storybooks. We have flashcards. Our flashcards range from Igbo flashcards, but then the words, as the kids are learning the Igbo words, they also learn the French words, the Spanish word, the German one, because we understand that parents also want to raise kids that are fluent in French, in German, in Spanish. So we do that alongside. So we're not just, we're more inclusive with the resources. So we have flashcards, we have storybooks. We also have virtual Igbo class where, sometimes I understand that, sometimes parents, because you have a curriculum and you're trying to put in everything, and you also want to be as vast as possible. So that's it. So we have tracing books as well. I'm still trying to figure out this camera thing because it's not coming on my end to me. I don't know. Can you help? It's not coming on at all.
I don't know. It's supposed to.
Is that something that you need to turn on? Because from my end, I can't do it. I've tried all the settings and it's just not working.
I don't know any settings. I'm supposed to.
I'm doing it for my phone. I was hoping. Well, yes, our website, our page, we're on, most of the socials at thatigbochild.com. And also, please, for the benefit of parents who'll be like, oh, is it just Igbo? The awesome news that I have for parents is that I partnered with my sister, and I realized that there are also parents that also want that are interested in these resources. So we came up with a brand. It's called Koli and Olum, and that's it has resources for all the African languages. So we have Yoruba covered there, we have Igbo covered there, we have Twi, we have Swahili as well. So yes, I'm very big on really about being parents raising bilingual kids, multilingual kids, because the way the world is moving. We just have to raise our kids, be conscious about this, and raise them to be ready for the way the world is moving. So so sorry this video thing isn't working. I have tried, and I was hoping that I could show some of our resources on video, but it's just not working. But we have it on our socials. We're on Instagram, we're on Twitter, we're also on LinkedIn as well. We also have a website as well, that's igbochild.com. So please check us out. And, you can always reach out to us as well. We're always more than willing to help and answer all the questions that you may have as well. Okay. Thank you so much.
One quick question is, do you mean that the flashcards come in not only Igbo, but other languages?
Yeah, so the flashcard, for example, it's Igbo alphabet. So let's say, for example, A, which is the first letter in Igbo, A, B, C. So A, just like we have A is for apple. So on the flashcard, you now have Aziza. Then it will show you the translation of broom in English. Then it would show you the Spanish translation of that same word in Spanish, that same word in French, and that same word in German. So yes. I don't know. There's a video I can. I don't know if there's time that I could share. Maybe send the video to Tony and
I'll share it.
Okay, I'll send it to you, and then you can share so that you can see what the Igbo flashcard looks like. It's a video. I can also show the video of the talking book, which is a brilliant audio book. It's a great introduction to alphabets, numbers, body parts, some folk stories, and it's brilliant. And things about like family, and when the kids press, they can recite it as well. So that's what we have for the talking Igbo book. We have coloring books, we have sketch books. We have I'm also a big fan of encouraging a learning atmosphere, an Igbo learning atmosphere. So you can do that with our wall chats. You have your numbers wall chats, which also comes in those languages as well. So for the one word in Igbo, it would have the English translation, the German, the French, and the Spanish. So we are quite big on understanding that parents also want to raise kids that that are fluent in French, in German, in Spanish, because of the interest and their amazing ability to just be able to grasp this language much quicker than adults. So I'm just sending out. We have storybooks, beautiful storybooks, all colorful, bilingual. We have toys. We're all about just making the Igbo language fun to learn. It's about making it fun. It's all about play and gathering the interest in learning this language, learning about the culture of the Igbo language. So yes.
All right, thank you so much. Thank you so much. So I'll still share more of our resources and what they're on about, and that video she spoke about. Yeah. So people want to learn Igbo. I want their children to learn Igbo. The handle is at that Igbo child on Instagram. Yeah. So the handle is at that.
If you send it, I'll send it now, please.
Okay. I'll share it.
Okay, and I'll send the one for the flashcard since someone asked the question. So I don't know if there were any more questions. Okay, I also wanted to mention that, please, we're also offering discounts at up until the end of October, because we're all big about just being able to have, for parents to be able to afford this resources. So please, we're doing discounts on our resources. So please, I'm more than willing to just answer any questions that anyone reaches out to us. I'm happy to answer any questions that they have, please.
All right. I've shared your handle in the comment section, and so please reach out. Discount code, please. Reach out to them via the DM. I'm sure they'll give you the discount code. Is there a discount code? Or they should just
I can create one just for this for the homeschooling conversations. But please reach out. We have contact numbers, and if anyone wants to reach out via WhatsApp, wants like a bundle, wants a bulk thing for maybe their homeschooling group, that's fine. Please reach out. I'm definitely willing to have conversation. Because one of the speakers had asked something about if people ask about discounts when they go on sessions. So please reach out. I'm more than willing to do that, please.
So if you ask, you never know.
Sorry?
No, I was saying that they need to ask. The handle again is that Igbo child. So I'm typing it again. That's
okay.
Igbo child. Yes. So thank you so much, Oge. So let's go to our final question for today for Mr. Akintomi. I'm sorry for keeping you waiting. I hope you're fine with
That's
that.
fine. I'll be checking out that Igbo girl, that Igbo child, actually.
Yeah.
Thank you so
Yeah.
much. Thank you. Thank you so much.
So our final question is, what inspired you and your family to approach this homeschooling style of education?
Knowledge. So I read like crazy, and my wife too reads a lot of books. So just exposing ourselves to knowledge that is not conventionally available as such, right? So that would be definitely the key thing that drove us to start thinking differently.
Okay.
Yeah.
Okay. Okay. So what would you say? How would you say it has been so far?
You mean in terms of homeschooling, unschooling, right?
Yes, for you guys, how would you say it has been so far? Are there any challenges that you guys have had?
So, okay, that's a weird question for me personally, because just last week, my friend said, "Something you act like you don't have any problems in life." So I don't really look at challenges. So the thing is, we have actually, so to also answer that in another way, we've made our lives so minimal, yeah, that we've cut out so many things that there are literally not too many challenges, yeah. So we've gotten into routine now. We've identified what we know where we want to end. We know our end goal. I know my purpose. My wife is also amazingly clear on her purpose, right? So it's easy to wake up and just leave. And again, let go and trust the process. So challenges, I see challenges as something that comes and goes. But also you have to bear in mind that my wife in unschooling is also not doing this as a way of validating herself or treating any trauma, right? She's literally like, has removed herself from the picture and focusing on the children. So when she wakes up, she's like, okay, we're going to so and so place today. And I'm like, fine, I'm going to the office. We come back, we have dinner, how did your day go, etc. So we don't see it like work. Does that make sense? In that sense, there won't be challenges if we don't see it like that.
Okay. Okay.
Yeah.
So, Mr. Akintomi Lajuwomi, right?
Correct. Yes.
Thank you so much. Thank you. I can't thank you enough, right?
Yeah.
I really appreciate your perspective. I appreciate your view to life, your paradigms, right? I really appreciate it, and I wish that more men can really learn, and adapt this thing. It will be a whole lot more easier, right, for homeschooling families that, especially in our clients, we have the mentality is different, Sha. So I'm really grateful for you. Thank you so much.
Thank you.
And thank you.
And like I just mentioned, right? Sorry, let me just say this. First of all, before I say what I want to say, thank you very much for the gift. Oh yes, salad that you sent to us. The salad made us say, oh yes, this afternoon. It was so nice. So thank you. Then secondly, for those that live in Abuja, we started, my wife started this, in their community, they also started this monthly hangouts for families, right? Where the dads come as well. The first one we had was awesome. In fact, the dads did not want to go. It was wives that said it's time to go. So we're just alike, talking about politics, talking about Tesla, very intelligent stuff. So that's one way that we can start to include that in the community, right? Where we make it more like a family thing, and then they get exposed to, what the wives are actually doing. So we did it in a park called Jabi Park, which is one of the parks that they go to. So it was really, really nice. And the next one we're going to be doing is a barbecue. So if anyone is in Abuja, you can add my wife at, I think it's raising.id, right? Raising.id, and then join the group. And you can come along. Even if you're not homeschooling, you can come. It's a weekend. Come with your child, come with your husband, and it's going to be a blast. I assure you.
Yeah, so so we're going to still share our information, everything by the end of tomorrow. because I'm a huge advocate for what Adishola is doing, and I'm really like you know I'm rooting seriously for her and all of that. So we'll share everything else tomorrow and also include everything in our final communication after the event. So thank you all for. I'm sure they will communicate the dates, right, for their next hangout.
Yes.
Okay.
They just message her on Instagram. And if anyone wants to reach me, they can reach out because I don't do social media. So she's the one that does.
Shalao, because I'm like.
Yeah.
But yeah, so thank you so much, everyone, for being with us till the end. We've come to the end of today's sessions, and for me, it has really been enlightening. And the full recordings are going to be on YouTube. And when I do have time, I'm going to split them up into different sessions, the sessions, but so that that part, you can cut it out and be playing it when your husband is there, So thank you all so much. Please share your learnings or anything that you learned today on Instagram. Tag me so that more people can come tomorrow and learn things, right? Thank you all so much. And tomorrow we're going to talk about that. We're going to talk about homeschooling 101, which is basically everything we'll talk about curriculum, talk about different approaches and all of that. So for all of us that are still new into the process, so we can learn something. So thank you all so much. I cannot thank you enough. I hope it was worth your time. Yes, it was worth your time. Thank you. Adios. Mm-hmm. Okay, how do you end?